Hello and welcome to the most awaited Global Rare Disease Conference 2021 on this International Rare Disease Day. I'm Dr. Archesman Mahapatra, Executive Director, GRID Council. We are pleased to be partners with the Blueprint for Rare Diseases initiative, along with People to People Health Foundation. This is the fifth in the series of consultations under this initiative. As we all know, that rare diseases pose a complex challenge. We do not have robust burden estimates, while we also know that taken together, the numbers are really high. We have issues of access to health services, and that's both on the diagnostic side as well as on the therapeutic side. Availability and affordability of healthcare is also of much concern. One of the biggest challenges is also of that of awareness. Now, the stakeholders are not much sensitized yet. We do not have policies for rare diseases at most places. There is also limited research and development happening in this domain. Nevertheless, the good part is that over the past decade, we can see that collective action is building up and we can see some momentum over there. While there is effort for making services available and to support these services as well, there are also voices for preventive strategies, and definitely preventive and therapeutic strategies hand in hand will hold the promise of impact. Now, before we get started with the enriching sessions that we have lined up for the day, I have some announcements for all. Now, over the next 3.5 hours journey that we will be doing together, we have some very interesting sessions. After the opening ceremony, we have 2 parallel tracks going on. So that's the session we have on best practices on rare diseases. Similarly, thereafter, we have another session, again 2 parallel tracks, where we shall be discussing about setting priorities and the urgency on rare diseases. After the sessions are over, we'll again converge back on the conference hall 1, and then we can take some highlights from the different consultations that have happened thus far, and we shall be discussing the initiative's journey, and then a call to action digital booklet will be released. We have a balloon releasing ceremony towards the end of the session. Now, all the sessions are interactive. The audience can send in their questions, and we shall take them up as per the availability of time. Now, we are also streaming live on YouTube and Facebook, so you can also catch us over there as well. Don't forget to download your certificates. By exploring the conference interface, you can always go and identify where you can type in your name and download your certificates. Even if you forget to do so, be assured that we have 5 days backup on the portal, so you can go back and watch the recording, and you can also download the certificates, but I'd insist that you do it today. There is a scribble wall. You can post one idea that would have maximal impact on the rare disease policy and program in India. We have a 15-minute break coming up after the opening ceremony where you can go to the scribble wall and write down your ideas. I would request the speakers to please stick to their allocated time. We have a very tight schedule, parallel sessions going on, and if we make it in time, then synergizing and moving on seamlessly between the sessions will become very easy. Now, without holding you back any further, let's get started. I would invite Dr. Lakshmikant Palo, the Chief Executive Officer of People to People Health Foundation, for his welcome address. To you, sir.
Thank you, Dr. Mahapatra. Good evening and good morning, everyone, and welcome to today's Global Rare Disease Conference on this International Rare Disease Day. I would like to thank you all for your participation in this important conference. PPHF is pleased to jointly host this with Niti Aayog, Government of India, and state governments of Karnataka, Government of Punjab, and Chandigarh and West Bengal. And this conference is co-powered by Takeda, and special thanks to Takeda for supporting this series. And also our strategic partners, RUS, ORDI, RDIF, LSSDS, Cure SMS Foundation, our research partner, GRID Council, and technical partner, Acuitas, and knowledge partner, Institute of Child Health, and media partner, ET Health World. The objective of today's conference are to discuss and learn best practices and ideas and way forward, how to improve the unmet needs in the management of rare diseases in India, also in globally other countries also. And produce a list of priority action points, how we can work together on those priority action points, and explore partnership opportunity across stakeholders and beyond the development of better infrastructure, diagnosis and management, and increase collaboration and commitment to take the selected action forward. Mainstreaming rare disease as a priority health agenda, we all need to see how we can critical break the barriers exist in terms of awareness, prevention, access to appropriate care, delay in diagnosis, and limited treatment option. But I'm sure together we can make a difference. This is our, I think, sixth series, kind of under this blueprint, and we started with just a year back. We started with a roundtable discussion on the national rare disease policy for India, and followed by another webinar on COVID and rare disease. Then recently we concluded 3 regional consultations in India on rare disease. So a lot of those recommendations will be said today, and we hope that those will be useful to us for our programming in future. Today we have a very combination of very high level global and Indian speakers. I would like to express my sincere appreciation to our today's speakers. PPHF would be very happy to work together and facilitate better access to health solutions on rare diseases with national and international partners, and we look forward to more collaboration in future. I am looking forward to your active participation in this conference today and beyond. Now I invite you all for the oath-taking ceremony with our Smart Warriors by Cure SMA Foundation. Thank you.
Hello everyone, my name is Deeksha. I am Arav. I am Irfan. Shaurya. Ridhima.
Just Jason.
Preeti. Devoshmita Ghosh. Sharon Weasley.
I am Karan, a smart human with spinal muscular atrophy rare disorder.
I request you to join me for taking pledges to support rare disease community. Are you all with me? Yes, I see you nodding head. Let's keep our right hand on our heart and make a promise to ourselves. Please repeat after me.
I pledge to contribute and support the rare disease community
To the best of my strength. I promise to make this world a better place for people with rare diseases.
I promise to help create awareness on rare diseases so that we can prevent many births with rare diseases.
I promise to help add quality years to the life of people with rare diseases.
I promise to contribute towards an environment full of psychological, emotional, technical and financial support for people with rare diseases and their caretakers.
I'm sure these promises can make a big difference in my life and lives of many like me.
Thank you.
Thank you. Thank you. Thank you. Thank you in advance for the commitment.
And thoughts for us.
Thank you.
Thank you, Dr. Paolo, for that welcome address, and thank you all our esteemed guests and audience for taking that post. We have a context setting video coming up, so I request the backend team to help us with the context setting video over there. Yes, can the context setting video be please played? Yes.
Rare diseases are lifelong diseases or disorders which can cause declining effect on the life's quality.
देखिए इलाज तो अभी मुझे प्रोवाइड नहीं हुआ पर वो इलाज जो है ना है वर्ल्ड के अंदर, लेकिन भारत में कुछ बच्चों को मिल भी रहा है, लेकिन वो बहुत कॉस्टली है, वो कुछ पॉलिसीज़ के थ्रू उन्हें बच्चों को मिल रहा है, तो मैं चाहता हूँ कि मुझे भी मिल जाए कोई पॉलिसी ऐसी।
I was fortunate to get this treatment free of cost through the company's charitable access program.
ये डिजीज इस तरीके से है कि अगर हम इसमें अवेयर रहें, हर एक फैमिली अवेयर रहे, तो आप इन चीज़ों को इस चीज़ों से रोक सकते हैं।
In India, the reported rare diseases are Gaucher disease, Hurler syndrome, Hunter syndrome, Pompe disease, spinal muscular atrophy MPS 4A, and more.
There was a difference of 2.5-year-old between both of them. Anmol was born in 1990 and Pramol was born in 1993. Being a rare disease parents, we sometimes used to have a vacuum in our life that why this happened to us. But at the same time, we took it as a challenge to us by the Almighty. We gave them the best care, whatever we could do. And I must admit and say that it is the love, affection and the personal care which prolonged their life than the medicine.
Giving hope for not just the one who has the rare disease, but also the caregiver who gets affected physically, emotionally and financially, often forgetting about their own lives and living only for their children. Treatment for Manjit's sons was possible. However, due to the various challenges related to awareness, access, research, affordability, timely diagnosis and treatment, he lost his children. This story repeats itself with most individuals who suffer from rare diseases. So far, about 450 rare diseases have been recorded in India, and at least 72 million people are affected by rare diseases. Time is of the essence. Timely diagnosis and treatment can make it possible for many patients to live a better quality of life. So what are the challenges? Lack of preventative approach, timely diagnosis, lack of treatment, awareness, access, affordability.
In terms of treatment, the cost is exorbitant and they have to be imported from many other countries. So I think that is a big challenge that the government is facing, and it will continue to face until we have our own innovative, the way Korea has moved ahead. It started manufacturing their own drugs, their own replacement therapies, like India started manufacturing diets. The similar pattern could be there for many rare disorders, and that's the way to move forward as it has been done for small molecule disorders.
I see three types of interventions happening. First, for the patients. Now, if I'm a patient, then I should connect. So I should not operate in isolation. I should connect with other patient groups. I should learn and also contribute my learning to this entire pool of wisdom that is building up from India. Individual patient stories are very important. They must be pitched to the highest levels, and at the same time, whatever learnings are coming up must be noted down in a very concerted manner.
I would say that much of the hurdles which we were facing in the past, we have been able to achieve most of the goals, and yet there remains some which we hope that we would be able to overcome in the future days to come.
If possible, fund some research on this. If you could fund not just programs but also researchers on this, then people would be attracted to take this up as careers.
In the coming era of genetics, with so many evolving technologies like CRISPR-Cas9, gene therapy coming in, there is definitely going to be a lot of improvement and advances that are going to address the rare disease community.
So if you are in a position and you have some interest, take this up as a career, or at least as a secondary career for yourself.
There had been immense good efforts regarding this, because the Center of Excellence, they have been identified and earmarked. So in different states, they have identified. And number two, what they have done is that, we have another project called Nidan project. So a lot of work is being done on rare diseases.
Now, you would not see results overnight. This is a long drawn fight, and initial resources, whatever you contribute, must be sustained. So take it up with a vision. Good that we have a policy coming up. At least some effort is there. We are having consultations around, committees are there which have intermediate and long-term goals.
People now are very confident. They know whom to approach for the care, support and treatment.
To bridge these gaps, a slew of subnational, national and global conferences on rare diseases are being organized in India, with the objective to bring the collective wisdom and commitment from all the key stakeholders on the same platform to prioritize solutions for preventing and managing rare diseases.
They were fighters. They never found it a disease, and they had no regrets about their disorders.
Patients with rare diseases should not lose hope. What is not treatable today will become treatable tomorrow. So keep the hopes alive.
Do not make information on rare diseases as rare. Make it common. Share your experiences and learn from one another. That's how we should come together for rare and make a change.
We are stronger together, more empowered to translate solutions to actions, adding life to years they live and years to their lives.
Thank you, team, for that context-setting video. Very nicely captures the plight of people with rare diseases, their families, and all the stakeholders involved. Moving ahead with the opening ceremony sessions, I would now request Dr. Mahendra Naik, who is the area head, ICME at Takeda. So ICME represents India, the CIS countries, the Middle East, Turkey, and Africa. Dr. Nayak has over 2 decades of performance-driven leadership across the pharmaceutical and broader healthcare industries. Sir, I would request you for your keynote address.
Thank you very much. Hello, everyone. It's indeed a great honor and privilege to be here with you today on this very important occasion. I believe it's a tremendous opportunity for us to celebrate today and raise awareness on rare diseases and recognize the community which serves the needs of these patients, both in India but as well globally. I'd like to welcome you all on behalf of Takeda, a value-based R&D-driven innovative global biopharmaceutical leader with a legacy of over 240 years. You may be interested to know that we are the largest pharmaceutical company globally that originates from the Asian continent. Our sincere gratitude to the PPHF Organizing Committee for inviting Takeda to the forum. Many thanks and recognition to the states who have co-hosted and participated in the regional consultations. It's truly encouraging to see how far the blueprint for rare disease journey has progressed over the past year. In fact, the rare disease landscape in India has seen tremendous progress since the initiation of such inclusive and open dialogue. We are grateful to have a seat at the table in sharing our insights, championing innovation, and supporting capacity building opportunities wherever possible. It is but obvious that bringing together all of us, decision makers, payers, innovators, is driving tangible results and putting us well on track to closing the access gap. We are doing this in an inclusive manner, completely in line with the sustainable development goals of universal health coverage. It's heartening to see that India is rapidly moving towards a national policy framework. And we are excited to see that we are inching closer towards its realization. I'm sure you all agree that only a universal mandate driven from the top and guided by a dedicated structure will elevate rare disease to the same level of priority as perhaps non-communicable diseases. So ever since our operations in India began, not so long ago, in 2011, in fact, our incredibly passionate and dedicated team have been working tirelessly to engage with the different stakeholders in order to understand the needs and best support patient communities across the country. So partnerships have been crucial in driving our success so far, working with societies, policymakers, and payers at various touch points to firstly understand the needs and achieve higher level of disease awareness, early diagnosis, and greater access to the treatment, as summarized in the video that you just saw. As you're all aware, the unmet need in the rare disease world remains considerable, with over 300 million patients, families, and caregivers impacted by one of the more than 6,000 rare diseases discovered by science till date. Treatment of these diseases will continue to require specialized clinical skills to screen, diagnose, and treat patients, and this will present significant challenges in the level of capacity and resources needed for prevention as well as education. And adding to the care ecosystem of the rare disease patient community are the patient support groups. Shaping the policy framework, these groups have been mobilizing legislation to support the development of programs that address the needs of millions affected by rare diseases in India, a large proportion of them being children. At Takeda, we have over 200 global partnerships to support patients. Our approach to any strategic partnership is largely focused on working collaboratively with multiple stakeholders and to find constructive and pragmatic solutions. Despite the pandemic's continued impact over the last year, our focus and dedication to close access gaps with rare disease persists. We remain steadfast in building trust and reputation in the community as true partners and leaders. With our legacy of more than 2 centuries, we at Takeda are keen to achieve a greater collaboration within R&D to ensure that we achieve a sustainable care model for rare diseases. And as a global biopharmaceutical leader, we also have a responsibility to model an innovative pricing approach that ensures value to the society that we live in. On Rare Disease Day, we once again reinforce our commitment to continue working closely with you so that we can collectively advance the management of rare diseases in India. Once again, my sincere appreciation for your cause, commitment, and collaboration. Thank you for your attention. Let's stay safe and stay connected.
Thank you, Dr. Nayak. In your short keynote address, you touched upon so many issues, which included like value-driven leadership, aspects of inclusivity, sustainability, universal health coverage, strategic partnerships, being very close to the patient action groups and providing to their needs. So many aspects you touched upon, sir. We're really thankful for having you for your welcome note. Thank you so much. Moving on to our next guest of honor, I would request Professor Rajendra Pratap Gupta, who is the chair, Dynamic Coalition on Internet and Jobs, Internet Governance Forum, United Nations, Mumbai Metropolitan Region. Gupta sir, over to you.
Thank you. And I really appreciate your invite to this important forum. And I firstly congratulate the leadership of Lakshmikant Palo, who has always, inspired me through his work. And so whenever an invite comes from People to People Health Foundation, I am actually waiting for it. The reason I say that is over the years when I've attended your forums, I have learned. And I think all the organizations working in healthcare should take the lead from what this foundation under this leadership does. And I think my video is not on there. Sorry about that. Can you see me? Okay, good. So, on this World Rare Disease Day, you have organized a very important meeting and you're releasing a report, and I had a chance to look at this issue even while writing drafting the National Health Policy 2017. So I want to share a fact with you that Karnataka, we were talking about the spinal muscular atrophy, and it is really, a touching experience to watch the videos of people who have kids suffering from such problems and who have lost kids also. For me, it was a big eye opener to see that, 10% of the people across the world have this, and only 5% would have access to some therapy. 200 children in Karnataka suffer from the spinal muscular atrophy. And what is shocking is the cost of therapy is, I guess, 16 crores. And I believe that none of us, even in this conference, can afford that. So last month there was a lucky draw, and a 14-month baby won that lucky draw to be given the therapy free from the company, which is a good gesture, and we must appreciate that. I also appreciate the partnership of Takeda and leadership of Mahen for supporting this initiative, because nothing can be done in isolation. With great thoughts, with great team like China, Meghna, and I'm sure a lot of people who have worked on these initiatives, it still requires resources to come out. So for us, it is like we can get this glimpse of the summary that the report will give us, but it requires a lot of work. I've been watching your each consultations 3.5 hours each, which shows the commitment of people to resolve the tricky issues that the countries face, and at least countries like ours, which are stretched for resources. And after COVID, the resources have become more stretched. Here it is where I want to put my word of appreciation for the work you have done, Dr. Lakshmikant and your team, that the way you have highlighted the priorities. First, define what is rare diseases, a very elementary thing, but most often people actually forget that. And you have been very clear about your approach, I think, which sets the way we should look at any other policy work that we do. You brought the focus there, prioritizing rare diseases, defining them, talking about their awareness, sensitization. I think an ecosystem approach that you talk about, which is really very interesting, and that is the way we have to look at screening, diagnosis, treatment, strategy. I was also, hearing about the centers of excellence, and I would submit here, since you are, giving your views to the government. And I see Rakesh Sarwal from Niti Aayog, and I understand he was also an advisor earlier during my earlier interactions. So we are fortunate to have him as an old hand at Niti Aayog. Is we need network of centers of excellence. We just don't need a center of excellence. We need a network, because these kind of diseases require multidisciplinary, multi-institutional approach to address the issues. I think the world is also talking about precision medicine. Last month, I was on a call with economists, with global leaders on precision medicines. But country like us will actually look at a very different level when it comes to precision medicine. But that is the way the world is moving. So even when we look at that, every disease, every patient is actually in some sense rare, because the way some genes affect the utilization of the medicines in a body is different from what it does to others. I think we need to have a scientific approach in addressing this. And best part of this entire reports that you are releasing are solution centric. They are not just talking about the challenge we face. You have gone in depth. You have talked about what are the options, what are the priorities, and what are the solutions we have. And that's the best part of the work you do. And I'm so happy that you've given me the opportunity to be part of such a forum. And we hope that your partners like Takeda, even Niti Aayog, for co-hosting this, will give the importance that these rare diseases deserve. Thank you once again, and congratulations.
Thank you, sir, for your very kind, appreciative, as well as encouraging words. In your keynote address, you rightly pointed out to the resource constraintness that people with rare diseases face. It's not possible for any individual. There needs to be an ecosystem approach. Network of centers of excellence are very important in this direction in terms of ensuring multidisciplinary as well as multi-institutional collaborations and efforts. Now, we also need to identify new scientific methods. Precision medicine is a way forward. And thank you so much for also refocusing us on being solution oriented in our approaches. So thank you so much, sir, for your keynote address. Moving on to our next speaker, we have Shri Rajendra Kumar, Director PMO's Office, Government of India, but last minute vaccine launch event has kept him away from us briefly. So he will be back with us as soon as he's done with that event, and we shall have him speak on a forum. I would now request Dr. Rakesh Sarwal, who is Additional Secretary Niti Aayog, for his keynote address. Dr. Sarwal, over to you, sir.
Am I audible?
Yes, sir, you're audible. Can you please switch on your video as well, sir?
I had it on. Let us start like this because I'm not able to get it. So I'm really honored to join this Global Rare Disease Conference today on the occasion of the International Rare Disease Day. I would say that this is a rare event in itself, to attend to those who are the most neglected, who need the care and the access and the attention the most, follows the principles of Antyodaya. And it is highly Gandhian, it is highly a touching moment, and the videos that have been recently played out, the stories of the children who have survived and who are living to the best of their ability in normal life, thanks to the support groups that they are in, and the providers and the pharmaceutical companies, are really touching. And I'm thankful to Dr. Lakshmikant Paulo for having invited me to this event. Am I audible?
Yes, sir. Yes, sir. Yes, sir.
Okay. So I congratulate the People to People Health Foundation, its CEO, Dr. Paulo, Takeda, the ICMEA, and the other partners for this initiative for doing multiple subnational consultations. And I welcome the representatives from the state governments also who are here today for all their interest and commitment on this very important and a national priority. As we have just heard, that rare diseases are defined as debilitating illnesses which are life-threatening and which are rare. They are not only in terms of incidence, but also the severity and the lack of easy treatment for them. WHO defines them as 1 per 1,000 population. We don't have a definition in India, but we know the diseases which are prevalent and which are rare in our country. So we have seen that both diagnosis, treatment, management, access, affordability, all of those are challenges in those affected by these diseases. And therefore, the need for multi-sectoral and the networking and the stakeholder approach, which has been talked about, is extremely important. The concept of prioritization, which we see in public health all the time, we talk of population attributable risk, we talk of DALI, we talk of the cost effectiveness. This attention to the rare diseases puts all of this on its head. None of this makes sense in terms of cost effectiveness or prioritization or in terms of cost benefit analysis, but nonetheless they are important. And why are they important? They are important because it affects every life, and every life is precious. And because universal healthcare principles on which we all are committed to means that till the last disease and till the last patient has to be healthy, and that is a national goal and national commitment. So it is extremely sensitive, and it is a very equitous concept that we are able to attend to this important topic today. So the prevention certainly remains the key, and I'm glad that the National Policy for Rare Diseases 2020 does pay attention in great detail to the various kinds of preventions, primary, secondary, and tertiary, which can be done in these cases. And this policy also talks about the 3 treatment types, again in great detail, the high cost one time, the low cost lifelong, and the high cost lifelong types of treatment that they have mentioned in this national policy are extremely detailed, and they have gone through the topic, and they present the solutions in a very, very scientific fashion. Now, in terms of suggestions, besides what has been said earlier, it's networking, sensitivity, attention, I would suggest a few more things. One is that to build the network both among the caregivers, the patients, the providers, and raise awareness, I think a virtual repository or a blog for sharing the experiences, both of the patients, caregivers, and providers, will be extremely helpful. And that can be a global blog, and our country can join in those blogs which are already available. I'm aware of some of the blogs of patients with more common diseases, where, say, diabetes or hypertension, where individual patients' experiences have been more valuable to others than the advice from a provider, because they have empathy. They're able to see through the patient's lens and put themselves in patient's shoes and advise and guide. So this kind of blog things are likely to be helpful, and that we can add in the policy document that is being prepared. The second is, I think, centers of excellence and networking is a great idea, but if we connect them through telemedicine and teleconsultation, then the ambiguity in detecting these diseases and the long time taken and the lack of orientation of the providers can be bridged, and the doctors can access this portal, telemedicine portal, should they suspect a rare disease, and somebody can really guide them. So one of the center of excellence can start this telemedicine center for rare diseases exclusively. My third suggestion is in terms of registry. We were promised a registry. I don't know how much it has gone forward, but I think that a publicly accessible registry where the providers can enter the case details from the electronic medical records will really make it crowdsourced and increase its value and depth. We could think of blockchain technology to give more credibility to this registry. And this again would give us more epidemiological data on the incidence, prevalence, and therapeutics of the cases affected. And that's an idea that we can consider. And lastly, about the funding part. While lotteries are great ways to finding out who needs to be treated or who can be treated, who has the luck to be treated, but I think ultimately we are accountable to each one of our citizens for their health. And the government funds of the Rashtriya Arogya Nidhi are fairly limited. And there's a problem of orphan drugs and orphan diseases. So a crowdfunding campaign where both the providers and the philanthropic organizations and the conscious individuals can contribute to a national fund, which then can pool out and invest resources from which the funding can be given to those affected. And of course, in this task, the cooperation and the coordination of the research institutions, the pharma agencies are extremely important. And in that regard, I appreciate the comments made by my predecessors on the forthrightness with which pharma companies are coming forward to help such patients. So in the end, I would really feel express my gratitude and extreme thanks to People Health Foundation for giving me this opportunity. And I'm really touched by the presentation and the videos that I've seen, and really hope to join in the campaign for giving a better life to the people affected by rare diseases. Thank you very much.
Thank you, Dr. Sarwal. While reiterating points highlighted by the previous speakers, you also touched upon many aspects which operate at two levels. One, the value systems, where you highlighted about Gandhian principles, Antodaya, also issues of being sensitive, accountable, issues of equity. Those are the value systems that you highlighted, but at the same time, sir, you were very objective in the suggestions that you put forth. So you suggested aspects of networking, leveraging technology, both in terms of like telehealth services where people could connect and readily seek advice, doctors could resolve their queries, aspects of building a repository, a knowledge repository, which can be both synced at the national as well as the global level, where people can actually contribute their own case stories as well. Aspects of having a crowdsourced registry where people can contribute information, and we build up a epidemiological database, and with quality if we leverage blockchain and other technological advances. You highlighted issues of funding, which can be crowdsourced. Several topics are you identified during your brief note, but at the same time, you also highlighted that contemporary epidemiology in terms of DALYs or different health economics related indicators have their own pitfalls and they do not adequately address the concerns that the rare disease community has. Thank you so much. This has been a very enriching session. So many, right from the start of today's conference, we have very fantastic ideas, very fantastic philosophical approaches suggested by our guests of honor. Sir, before we conclude this session, there is one question that has already come up. And I'd read that verbatim. The question is, rare disease treatment also needs review and exemptions of duties, taxes, in order to bring down the cost of treatment and enhance access to treatment for patients. Sir, would you like to react to that, Dr. Sarwal?
This is a very important point, and I think there is no disagreement on that. There can be no disagreement on that, and I would suggest that we include this point in the report that is being consideration.
Yes. So thank you, sir, for responding to that. Mr. Avinash, we in our keynote addresses, there have been aspects where people have, where the guests have very aptly highlighted how they're trying to contribute to the funding ecosystem. Dr. Sarwal also pointed out regarding the rare disease policy that is being considered, and that policy has very deeply gone into the matter and has thought of costs as well as duration of treatment that people would need. So, of course, this is a very pertinent challenge, and we are open to all sorts of suggestions, and all of that is being considered as the policy is being drafted. I'm very much thankful for the insightful addresses that we just had from the guests of honor. Thank you so much, sir. This has been a very, very enriching opening session. Thank you so much. We are running a bit ahead of time. We can still take a good break of about 15 minutes at least, and then we touch base again in 15 minutes to see if we are good to go for the next session. In these 15 minutes, I would request the audience to access the Scribble wall. You please put down one comment each that you feel that would be most contributory for the Indian rare disease policy and program to make an impact. So please go to the Scribble wall, and as you come back, we have parallel sessions starting up. So the first session is on best practices on rare diseases, and 2 tracks side by side, one coordinated by me, the other by my colleague, Mr. Saad Alam Khan, and you can join any of that. So before we move on there, once again, I take this opportunity to thank all the guests of honor. Thank you so much. Thank you so much, Dr. Nayak, Professor Gupta, Dr. Sarwal, and as I said, we shall have Sri Rajendra Kumar coming in as soon as the vaccine launch event is over. Thank you. We take a break over here.
Thank you. Thank you very much, Mr. Mahapat.
Thank you, sir. So as you note down your suggestions on the scribble wall, we're trying to get you the video. You can enjoy this video, but please ensure to go and write down your suggestions on the scribble wall. This is a way of having yourself heard, because anything that you write on the scribble wall will take a noting of that.
Dr. Mahapatra, this is Dr. Sridhar here. I have a message on the chat box for you. Can you please check?
Sure, sir, I'll check.
Rare diseases are lifelong diseases or disorders which can cause declining effect on the life's quality.
देखिए इलाज तो अभी मुझे प्रोवाइड नहीं हुआ पे वो इलाज जो है ना है वर्ल्ड के अंदर, लेकिन भारत में कुछ बच्चों को मिल भी रहा है, लेकिन वो बहुत कॉस्टली है। वो कुछ पॉलिसीज के थ्रू उन्हें बच्चों को मिल रहा है, तो मैं चाहता हूँ कि मुझे भी मिल जाए कोई पॉलिसी ऐसी।
I was fortunate to get this treatment free of cost through the company's charitable access program.
ये डिजीज इस तरीके से है कि अगर हम इसमें अवेयर रहें, हर एक फैमिली अवेयर रहे, तो आप इन चीज़ों को इस चीज़ों से रोक सकते हैं।
In India, the reported rare diseases are Gaucher disease, Hurler syndrome, Hunter syndrome, Pompe disease, spinal muscular atrophy MPS 4A, and more.
There was a difference of 2.5-year-old between both of them. Anmol was born in 1990 and Pramol was born in 1993. Being a rare disease parents, we sometimes used to have a vacuum in our life that why this happened to us. But at the same time, we took it as a challenge to us by the Almighty. We gave them the best care, whatever we could do. And I must admit and say that it is the love, affection and the personal care which prolonged their life than the medicine.
Giving hope for not just the one who has the rare disease, but also the caregiver who gets affected physically, emotionally and financially, often forgetting about their own lives and living only for their children. Treatment for Manjit's sons was possible. However, due to the various challenges related to awareness, access, research, affordability, timely diagnosis and treatment, he lost his children. This story repeats itself with most individuals who suffer from rare diseases. So far, about 450 rare diseases have been recorded in India, and at least 72 million people are affected by rare diseases. Time is of the essence. Timely diagnosis and treatment can make it possible for many patients to live a better quality of life. So what are the challenges? Lack of preventative approach, timely diagnosis, lack of treatment, awareness, access, affordability.
In terms of treatment, the cost is exorbitant and they have to be imported from many other countries. So I think that is a big challenge that the government is facing. And it will continue to phase until we have our own innovative, the way Korea has moved ahead. It started manufacturing their own drugs, their own replacement therapies, like India started manufacturing diets. The similar pattern could be there for many rare disorders, and that's the way to move forward as it has been done for small molecule disorders.
I see three types of interventions happening. First, for the patients. Now, if I'm a patient, then I should connect. So I should not operate in isolation. I should connect with other patient groups. I should learn and also contribute my learning to this entire pool of wisdom that is building up from India. Individual patient stories are very important. They must be pitched to the highest levels, and at the same time, whatever learnings are coming up must be noted down in a very concerted manner.
I would say that much of the hurdles which we were facing in the past, we have been able to achieve most of the goals, and yet there remains some which we hope that we would be able to overcome in the future days to come.
If possible, fund some research on this. If you could fund not just programs but also researchers on this, then people would be attracted to take this up as careers.
In the coming era of genetics, with so many evolving technologies like CRISPR-Cas9, gene therapy coming in, there is definitely going to be a lot of improvement and advances that are going to address the rare disease community.
So if you are in a position and you have some interest, take this up as a career, or at least as a secondary career for yourself.
There had been immense good efforts regarding this because the Center of Excellence, they have been identified and earmarked. So in different states, they have identified. And number two, what they have done is that, we have another project called Nidan project. So a lot of work has been done on rare diseases.
Now, you would not see results overnight. This is a long drawn fight, and initial resources, whatever you contribute, must be sustained. So take it up with a vision. Good that we have a policy coming up. At least some effort is there. We are having consultations around, committees are there which have intermediate and long-term goals.
People now are very confident. They know whom to approach for the care, support and treatment.
To bridge these gaps, a slew of subnational, national and global conferences on rare diseases are being organized in India, with the objective to bring the collective wisdom and commitment from all the key stakeholders on the same platform to prioritize solutions for preventing and managing rare diseases.
They were fighters. They never found it a disease, and they had no regrets about their disorders.
Patients with rare diseases should not lose hope. What is not treatable today will become treatable tomorrow. So keep the hopes alive.
Do not make information on rare diseases as rare. Make it common. Share your experiences and learn from one another. That's how we should come together for rare and make a change.
We are stronger together, more empowered to translate solutions to actions, adding life to years they live and years to their lives.
So before we resume the next session is lined up in another 15 minutes time. We still have 15 minutes in hand. Please go to the Scribble wall, write down your suggestions, explore the conference venue. You can download your certificate and any suggestions that you have, any questions that you have, you can send that to us in the chat window. So we still have 15 minutes. We are in break and shall resume the next session in parallel. So there will be 2 tracks to it. It's like any other usual physical conference where you can move from one hall to the other, come back, go back and forth, whichever way you want. But over the next 2 sessions are actually having 2 parallel tracks. The first one is on best practices on rare diseases, in which in Conference Hall 1, we'll be having the panel discuss about policies and partnerships. And in track 2, that is in Conference Hall 2, in parallel, We have the engagement of patient advocacy groups to influence policies and programs. So all discussions around that happening in Conference Hall 2. And as soon as we are done with that, with this session, we again take a short break, come back for 2 more parallel tracks for session 3. So session 3 would be on setting priorities and the urgency on rare disease. So since the resource is very constrained and we are actually facing a lot of challenges in this rare disease space, we need to prioritize. So this is an important session that is coming up. And again, we have 2 parallel tracks. In Conference Hall 1, we have discussions on mobilizing resources and sustainable funding mechanisms for treating patients and for research and for the overall rare disease program. While in Conference Hall 2, simultaneously, we have discussions on better infrastructure and improving the capacity for early diagnosis, monitoring, education, and research. So that's the Conference Hall 2 proceedings that we have in parallel to that in Conference Hall 1. As soon as that session is over, we converge back again. So we do not have any further parallel tracks. We come back to Conference Hall 1, where we have highlights from the regional consultations that have already happened as forerunners to this global conference. And we shall be discussing the journey of the initiative thus far. And there is a call to action booklet being released and a balloon releasing a ceremony before we conclude for the day. So that's the plan we have. And we have about 15 more minutes to go. Please go to the scribble wall, write down your suggestions so that they could be taken up as we compile the reports. Your suggestions for interventions or initiatives that could bring in maximal impact in the National Rare Disease Program and policy for India. So we'll meet again in 15 minutes time as you go and write down your suggestions on the scribble wall. For the next 5 days, you can still download your certificates. You can still watch the recording of this entire conference, but I would suggest that you do it now itself. So the next session would start in 15 minutes time. Please go to the scribble wall and write down your suggestions.
Hello everyone, my name is Deeksha. I am Arav. Namalvan. Shaurya. Ridhima.
Just Jason.
Preeti. Devosmita Ghosh. Sharon Weasley.
I am Kal, a smart human with spinal muscular atrophy rare disorder.
I request you to join me for taking pledges to support rare disease community. Are you all with me? Yes, I see you nodding head. Let's keep our right hand on our heart and make a promise to ourselves. Please repeat after me.
I pledge to contribute and support the rare disease community
To the best of my strength. I promise to make this world a better place for people with rare diseases.
I promise to help create awareness on rare diseases so that we can prevent many births with rare diseases.
I promise to help add quality years to the life of people with rare diseases.
I promise to contribute towards an environment full of psychological, emotional, technical, and financial support for people with rare diseases and their caregivers.
I'm sure these promises can make a big difference in my life and lives of many like me.
Thank you.
Thank you. Thank you. Thank you. Thank you in advance for the commitment
and thoughts for us.
Thank you.
So currently we are in break and we shall be resuming the next session about 12 minutes from now. This break is for the audience to go to the scribble wall and write down their suggestions for improving the rare disease policy and program in India. We are taking a note of all of that, and you can also use this break to download your certificate. And we look forward to having you back in about 12 minutes. So that's session 2, best practices on rare diseases. And there are 2 parallel tracks. You can join Conference Hall 1 or Conference Hall 2. So we have just about 5 minutes to go before we get started with the next session. If you haven't yet written down your suggestions on the scribble wall, please go and note it down so that we could collate all of that as we prepare the reports. In 5 minutes, we'll be on with the next session.
Hello, Duran.
Hello, can you hear me?
Yes, yes, loud and clear.
Thank you, thank you.
Hello, Susan.
Hello, hello everyone.
Yes. Hello, Dr. Madan
Hello,
Gopal.
Dr.
Hello.
Yes, Dr. Mohapatra. Yes, good evening.
Yes, good evening. We are in different, like both of us
Yes,
are in the
yes.
same part of the world, but I see that it is early morning, I guess, at some parts, and also further deep into the evening.
Yeah.
Right. So we have 3 more minutes to go before we go live with the session. I could see that Ms. Suzanne and Ms. Durhan and also Dr. Sridhar has already joined. So yeah, we can use this moment to see if our videos are working well or not. Dr. Sridhar, can you just confirm if your video is on? I could see, yes.
Hi, good
Good.
evening,
Yeah, we can
everybody.
hear.
Good evening, Dr. Sridhar.
Good evening, Dr. Madan. Good evening.
Right. So just 2 more minutes before we go live with the session. So welcome back, everyone. We had a break, and I assume that we have had a chance to go back to the scribble wall and write down our suggestions. Exciting session coming up. Practices on rare diseases, and there are 2 parallel tracks. This is Conference Hall 1, where we shall be discussing about policies and partnerships. There is a parallel track 2, where my colleague Mr. Saad Khan is coordinating discussions on engagement of patient advocacy groups to influence policies and programs. So in this track, over the next 50 minutes, we have the opportunity of listening to 3 very nice speakers, and I shall be introducing them to you. To start with, I must introduce the moderator for this session. Dr. K. Madan Gopal, Senior Consultant Niti Aayog, shall be moderating this session. So we will have 5 minutes for him to open the session, and then towards the end, 5 minutes to summarize the discussions and any questions that we may have. Speaker 1 is Ms. Suzanne Wispeka. She is the head Access to Medicine GEM Takeda, and she shall be talking about action for rare diseases together to drive impact. Coming up next, we have Ms. Darhen Wong-Riga. She is the president and CEO of Canadian Organization for Rare Diseases. Then next, we have Dr. Sridhar Sivasubu, who is scientist, CSIR, Institute of Genomics and Integrative Biology, and co-founder of Guardian, New Delhi. And he shall be talking about personal genomes to precision medicine, implications for rare genetic diseases in India. Exciting session coming up. Madan Gopal, sir, it's your floor. Sir, can you please unmute? You are muted.
Okay, thank you, Dr. Mahapatra. It was very nice interacting and listening to all the eminent speakers during the inaugural ceremony. And it's very interesting that the field of rare disease is very complex and heterogeneous. And now, from the complexity, we are trying to move towards precision medicine, and we are trying to see that how the services are made accessible, affordable, and that we are moving towards that. But the landscape is constantly changing, and the new and new disease, as the definition is progressing, so we are adding newer and newer disease as the scientific technology and advancements are happening. So new and newer disease will be coming into the medical literature. The rare diseases are defined. The definition is very interesting because unless we are having a clear-cut definition, it's very difficult to define it. Apart from that, rare diseases are, in most of the conditions, they are serious, chronic, debilitating, and life-threatening, and often require long and specialized treatment. In the inaugural address, Dr. Sarwal has already mentioned that we can segregate the disease into 3-4 parts. I am not going into that, but nevertheless, it often results in some form of handicap sometimes, which is very extremely severe. This kind of things happens. Early diagnosis of rare disease is a challenge to multiple factors that includes lack of awareness among the primary care physicians, lack of adequate screening, and lack of adequate diagnostic facilities. One of the interesting things, even in the medical parlance, what we say that unless you are clinically aware to diagnose a disease, you won't be able to diagnose that disease. One of the commonest example, I'm not talking about the rare disease, one of the commonest disease which is often missed out in the diagnosis, clinical diagnosis, is the hypothyroidism. It manifests in very different ways. I'm just want to highlight the level of the understanding which we people are. Unless there is higher degree of precision in making a clinical diagnosis, we are not able to find out what is the condition, and it would be just taken as a syndrome of some syndromic manifestation of some of the commonly occurring diseases. So the challenge is there in the research and development. We know now with the advancement of the technology, we will be knowing not about the pathophysiology of the disease and the occurrence, but nevertheless, we know very little about the pathophysiology of these rare diseases. Another thing is the challenge in the treatment. The treatment, that is availability of the treatment and access to the medicine, which I have already mentioned. And the next important thing is a prohibitive cost of the treatment. So these are the limiting factors. So far in India, we are having 450 diseases that has been recorded, and tertiary care hospital. One of the important things which I have been grappling is how to have a policy for these rare conditions. The prevention aspects, he has talked about that. I'm not touching the preventive aspect, but one of the important aspects being a public health practitioner is the cost, because India is a resource constrained nation. We have to prioritize our public health policies and public health expenditure. So how to prioritize, how to bring the relation of the rare diseases into the mainstream discussion. That's a very, very difficult, because the cost of the providing primary health care and the cost of providing this thing is to be balanced, and it is very difficult to do that. There have been many efforts made by the government in the past to see that how we can at least have a policy of this. Based on the directions of the High Court, the 3 committees were there. We suggested some roadmap for the rare diseases. Apart from that, the ministry has come up with a policy for rare diseases, which is in the consultation phase. They have uploaded it on the website for consultation, but due to implementation challenges, as rightly said during the inaugural session, that it's a state subject. This health is a state subject, and the state government has to take a call on how to go about this diseases. One of the important challenges when we are pushing for policies is the issue of cost effectiveness of intervention for rare diseases and the other health priorities. The other is the sharing of expenditure between the state and the central government, because most of the centrally sponsored schemes or central sector schemes, they are in the form of a sharing 60-40 or 90-10. That kind of ratio is there. But we have to find a mechanism once we are coming with a solution for the policy. Once we are giving the policy suggestions, then we have to factor this thing, because the how to bring the narration of this thing into the state government narration as well as the central government narration, that's the challenge, because there are some implementation challenges around that. Apart from that, another thing is each and every state of the country is itself, it's a by the sheer size of the provinces in the country itself is equal to some of the European countries. So we have to see the and the culturally and the practices wise also, the southern part is different, the northern part is different, the eastern side is different. So we have to have a policy which can at least influence and bring out all this together, so that we can have a judicious utilization of the resources whatsoever which are available, so that health outcomes of these rare diseases are being influenced, so that the access and so that there is care for this rare diseases become accessible and affordable to all. So over to you, please.
Thank you, sir, for that opening talk. And we shall be proceeding with the speakers. In the meantime, the audience can write down their questions, and we shall be noting them down, and also trying to we shall try to take some of them, time permitting, of course. The next talk we have coming from Ms. Suzanne Westbecker, and she's the head access to medicine GEM Takeda. Over to you, ma'am.
Thank you very much. And thanks so much for having me today. It's a big honor and pleasure to talk about the importance of partnerships. I'm having some slides, and I thought they are being shown. If not, I'm happy to share my screen. Okay, then I share my screen. No, here we go. Thanks so much. Okay, if you go to the first slide, to the next slide, thank you. So I thought talking about partnerships in rare diseases, we already touched on the challenges in particular for access in rare diseases. And then I wanted to talk a bit about what is our Takeda approach, how we look at access and how we actually try to partner, and that comes on to the third point, the importance of the multi-stakeholder and cross-sectoral partnerships, in particular in rare diseases, because we already heard earlier that only together we can really make a change, in particular to a challenging situation as we see it in rare diseases for access. So if you go to the next page. So we learned already earlier also about how many patients are affected and people are affected. And if we look at the broader part of non-communicable diseases, we have about 40 million people that die each year from non-communicable diseases, and 100 million people, in particular in low and middle income countries, are forced into poverty annually just by managing financially the impact of non-communicable diseases. So we see there is even for NCDs, where rare diseases are a smaller part, even for NCDs already is a huge need. And we learned it earlier also a bit in the videos and in the discussion, that there is a high unmet need in underserved communities for rare diseases, in particular also in India. If you go to the next page. So what we talked about earlier as well is the need for driving early diagnosis, in particular for rare diseases. There is typically a longer journey. And then also the second aspect is reducing the catastrophic financial impact that access to rare disease has. Yes, thank you, it was perfect. Which brings me to how we want to drive impact for for rare diseases, because we just know we can only do it together. Working against the UHC, Universal Health Coverage, and the Agenda 2030. We need to come together as partners under the guidance of the government, as well as cross-sectorial within the health and pharma sector. So for us, that's very important. And that brings me to the next point, like how we in Takeda also look at access to medicines. If we can move on 2 slides. What our approach is in Takeda. Next one. So we focus on providing access to our innovative medicines, and that of course includes rare diseases, like for example, Gaucher. And we want to do that by mobilizing collective action, because only if we work together under the leadership of the government and in alignment with local country strategies, we drive impact to patients. And for us, very important is also that we look at the access challenge holistically. So we look across the entire patient journey, from awareness to diagnosis, treatment, as well as emotional care and patient support. So that's basically the vision that we have for access to medicines at Takeda. We go to the next slide. Thank you. So here you see it the same, like more structured, written down. So we have 4 pillars. One is innovative access, literally providing access to the product. Then shaping patient advocacy, as well as public policy. And the third one is capacity, meaning capabilities building. And all is based on strategic partnerships. And again, all these 4 pillars aim to strengthen health system. So it's the product, it's the policy angle, it's training, for example, of physicians, capacity building, and all together as partners. And as also mentioned, it goes across the entire patient journey. That's for us very important, because just providing the product won't increase and enhance diagnostics, for example. If we go further. So that's now a snapshot about all our activities. And again, you see here in the different colors, our 4 strategic pillars. And we know, thank you so much for the cursor. We see there we have the innovative access programs with the PAPs, we have capacity building, all based on strategic partnership. And we are starting towards shaping public policy and building patient advocacy. So as you see, we are quite busy, but of course we understand also we can do much more. If we go to the next page. So if we look at how we broaden access through innovative models, then for us it's also very important to understand and to apply models that target each part of the affordability pyramid in a country, and that includes assistance programs as well as donation programs. So taking that more from the more theoretical level, if we go to the next page, to how do we actually drive access for rare diseases? There, the multi-stakeholder partnership and models really have proven to drive impact. If we go to the next page. So we put and brought together a consortium of partners for cancer in Meru County in Kenya. So for us, that's the blueprint for innovative healthcare. It's a pilot. And as you see, it's a blueprint because we say we bring together the different partners. We started with a global blueprint meeting with some stakeholders back in 2016, and now we were able and managed to drive the entire initiative towards cancer care. And we have a similar vision for rare diseases. So again, what we have seen in cancer care is we need local partners. We need the support and the guidance of the local government. And only if we bring in together the local partners that have the knowledge and expertise, and we can further build capabilities and capacities, that really drives impact, in particular for rare diseases. And if we go to the last page. So we, as mentioned, we want to drive impact, and we are working there with an NGO from Duke University, which is called Innovations in Healthcare, to really measure what are the outputs, the short-term outputs, like the midterm outcomes, and the longer-term impact on health systems. So that's now for us one of the key areas to focus on, to really make sure that we as partners also feel all accountable, that we have ideally an industry standard to measure our progress and impact. And of course, also building and informing all the stakeholders about the results and the impact we have will also help us to learn and to work even more effectively going forward. Thank you.
Thank you, Doctor. Thank you, Ms. Suzanne. Thank you. That's in fact, Dr. Madan Gopal would anyways summarize your talk, but I've taken down snippets. Dr. Madan, are you trying to say something, sir? You're muted.
Yes, Suzanne, I just want to ask you one question. Are you proposing some specific guidelines for the country, Indian country, based on your experience? Okay, what kind of collaboration we should be following so that we can have an expected disease outcome in the country, because it's a very diverse country. What's the model you suggest?
Yes, so where we have good experience, for example, that's why I brought the blueprint project for the pilot from Meru County in Kenya. So it's one county, right? And if you look at India, it's also, as you mentioned, Dr. Gopal, it's very heterogeneous. So we need to find on a state level, for example, or even further down, an entity where we can drive with partners' impact, where we can show and establish a partnership model for rare diseases. And given the complexity of India, it cannot be for the entire country, I agree.
Right. So, thank you so much, madam. In your talk, you covered, you talked about the strategic pillars that Takeda is having going forward with its efforts for rare diseases. So you talked about innovative access models, you talked about strategic partnerships, capacity building efforts, and also interventions at the policy level. You emphasized on our universal health coverage and the sustainable development goals need to align with the different stakeholders' priorities, including government as well as individual patient priorities. Thank you so much. Coming in next, I'd request Ms. Thank you, madam. Request Ms. Darhen Wong Riga for her talk.
Thank you very much. Shall I share my screen or would, somebody's doing the slides. That's perfect. All right, so thank you very much. First of all, my huge thanks to the organizers for the kind invitation. I have actually been in India probably a half a dozen times to talk about rare diseases. Better all the other times because it was always in person. So we will do our best not to actually get to experience India by doing it this way, but it's always been a pleasure. And I'm going to speak to you, yes, as president of the Canadian Organization for Rare Disorders, but really I want to talk to you as the president of the Council for Rare Diseases International, which is our global alliance for rare disease organizations, and probably repeat some of the themes that Suzanne talked about. We are so very pleased actually to be working in the kinds of partnerships that she's talking about. And I do want to talk about partnerships. And I want to talk especially about the value and the importance of India coming into the global economy. Because it is, in fact, I think, obviously a major country, a country that has lots of resources, and a country that can contribute significantly to our enhancing rare diseases on a global scale. So I want to talk about why global policy is important and the kind of things that Rare Diseases International is trying to do to advance that, but also the number of partnerships that are being formed and the ways we're hoping that India will also take even a bigger role. You're always involved in some of them. Next slide, please. So this is Rare Disease International, is the global alliance of people living with rare diseases across all nationalities, all rare diseases. We are, in fact, a patient organization in the sense that, I'm sorry, I'm getting a bit of trying to figure out how. Can we go back a slide? Is there any way? I'm getting a real.
Can everyone please mute yourself in case you're still on?
Okay, that's better. I'm still getting there.
Yeah, can I request the participants and the speakers, everyone, please mute yourself.
Okay, let me try again. I'm sorry. Because I
think
hear
Dr. Mohapatra, go ahead. Please stop your video. It will be better now. Please stop it.
I don't know. Does that make it? It's still the audio echo. I cannot.
Yeah, can
Ma'am, can you hear me? Can you tell me what's the issue you are facing?
I can hear you, yes.
What issue you are
there
facing,
was a bit
ma'am?
of echo.
No, I'm getting an echo. When I speak, I get my voice again, like a second later.
Okay, ma'am, have you logged in the conference portal?
I've only logged into this site.
WebEx meeting only?
Yes, just here. Nothing else. Oh, it's okay, just me talking to you, but otherwise it's a bit terrible echo.
Right now it's fine, ma'am?
Right now it's fine.
Right now it's fine. Okay, let me just share your PPT again. Okay, and we have already kept everyone mics on.
Okay. Okay, we'll try it again. I'm really sorry for having to stop. It was just that I could not speak if I heard myself a second later. So I just wanted to introduce Rare Disease International. And as you can see, we are made of national alliances of rare disease organizations. And in fact, there are the Indian Organization for Rare Disorders is also a strong member of this coalition. We have about 100 different countries that are represented. And we really try to work in partnership, obviously, right across the different stakeholders. Next slide, please. This reiterates a lot of what I think Suzanne was saying as well. Our real belief, of course, is that it takes a global voice. Rare diseases are global. They affect all patients, populations in every country. And again, it really, because the numbers are small, it really does require everybody working together. And Rare Diseases International, one of our big objectives has been actually to place rare diseases in the global platform. You can see some of the things that we've been doing to that end, and Rare Disease Day at the United Nations, our inclusion of rare diseases in the UN Declaration of Universal Health Coverage. That was something that was a huge advocacy effort on our part. Our partnership very recently now with the WHO setting up a memorandum of understanding, which has opened up a lot of different kinds of opportunities for us in terms of collaboration with other world organizations, including the UN, including the Office on Human Rights. So this is, in fact, something that we're going to continue to advance, and I'll talk to you a little bit about our next initiative in that line. But we feel it is so important that rare diseases, like non-communicable diseases, like infectious diseases, like HIV, must be recognized at a global level to also invite global partnerships, both from the point of view of investment, but also from the point of view of calling upon the governments to actually recognize and to make rare diseases a priority. Next slide, please. So this is, in fact, our push towards rare disease and universal health coverage. You've heard Suzanne already talk about it. For us, this was hugely important because as around the world, as countries were coming into universal health coverage, there was also the fear that rare diseases, being a neglected condition, being something that has been pushed aside even in the most developed countries, that we did not want that to happen as countries were bringing in their programs on universal health coverage. So we pushed specifically for rare diseases to be identified as a important priority under universal health coverage. We also, of course, recognize that it's not just about healthcare, but it's right across the spectrum in terms of the need for recognition, in terms of economics, in terms of education, and in terms of other kinds of supports that would have to be made available to beyond health in order to assure that people living with rare diseases were also going to be able to take full benefit of becoming a part of the society. So next slide, please. This is something that's very exciting, and we would love to have you, talk about it as well. And it talks a bit about where we hope India will be as well. As part of our memorandum of understanding with the World Health Organization, we are embarked on the formation of a collaborative global network for rare diseases, called for short CGN4RD. The vision is to have rare disease centers of expertise across the globe. There would be hubs in each one of the WHO regions. There could be sub-hubs that would be more country-specific. And the goal then is to really be able to have these hubs that would actually be able to serve all of the other outlying regions. And this is something that we have been trying to do, as we say, in collaboration with the WHO. Consultations have begun already. Again, some of our Indian partners have taken a role in that. And another big emphasis of it is that the hubs would not only just serve their immediate area, but they would serve also the areas around them. They would serve also to increase the capacity, as Suzanne talked about, increase the training, increase the appropriate use of medicines, increase the diagnosis. So it comes across all of the spectrums that Suzanne talked about. Good diagnosis, centers in which they can be recognized, patient public empowerment, support for access to medicines, and then also an investment in research. So it's a long-term agenda. We're not thinking this is going to happen tomorrow, but hopefully by the next year, we will have done a lot of the scoping. By 2025, we'd see the first hubs being put into place. So hopefully very much this is something that India can think about, but it's also a blueprint for how these centers can work within a country. That is, again, having hubs, having regional hubs, having state hubs that can serve not only their state, but also be connected across the country. Next slide, please. So this is another area, again, in which we are very much involved in as patients organizations, but beyond that. And this is the International Research Consortium on Rare Diseases. It was a huge initiative, now will be 10 years old, bringing together organizations and member states and industry to work collaboratively in terms of advancing diagnostics on rare diseases and also in terms of development of new therapies. Those are the two main mandates for it. And again, it's a multi-stakeholder engagement, which is very unique. It works on multi-stakeholder projects. Two of the projects right now are things that I'm sure that India itself could lend a great deal to. One is the repurposing of therapy. So there's a new task force that is being put together on how we can more deliberately repurpose the therapies that are either already in use or therapies that have been developed but have not been put into use for rare diseases, and another one on looking at rare diseases that are highly neglected. Sometimes these rare diseases are neglected because they are, in fact, very much confined to one area or one country. Next slide, please. The Global Commission to End the Diagnostic Odyssey for Children with Rare Diseases. This is a global initiative that we've been involved with. Takeda has actually been a huge partner in it. And the goal is to try to reduce the time to diagnosis by improving all of the aspects of it in terms of awareness, in terms of the tools that are used for diagnosis, calling upon many of the advanced AI, high-tech kinds of tools, and also then being able to improve the connection of patients 2 specialists, and this fits in with the first project that I talked about, and that is the Global Collaborative Networks. Again, this is an initiative in which we are hoping more countries, more industries would actually get involved in, as well as different kinds of organizations. Next slide, please. So this is something that has been in the Asia-Pacific region and very deliberately set up by the Asia-Pacific Economic Coordination, which is to have and support rare disease, to have a rare disease network which would support rare disease plans in the different regions. And again, has been instrumental in terms of helping to set up national plans in different countries around the Asia-Pacific area, which also includes countries in Latin America and in North America. Next slide. So this is something that has been very important for us. And a few years ago, the United Nations, we had set up the Non-Governmental Organization Committee for Rare Diseases. So we now have a presence for rare diseases within the United Nations. This has been a huge opportunity. It's a multi-stakeholder group, and we hosted, for instance, have hosted 2 forums now within the United Nations on rare diseases, supported by many of the member states, and have been very, very, I think, fortunate in terms of being able to engage a lot of the other agencies in terms of support. The whole notion is to recognize rare diseases and the importance of persons living with rare diseases to be included in all of the different kinds of strategic development goals. Suzanne gave you a high-level slide on it before. This is us being within the UN to try to enforce the willingness of the rare disease community to help push that forward, but also to increase the recognition of the priorities for addressing people living with rare diseases. Next, please. So this again is another slide that shows the institutionalization, the implanting of rare diseases within the Sustainable Development Goals. And I think we firmly believe, I think as Suzanne also mentioned there, that there's no way that globally we can meet those Sustainable Development Goals unless we actually address the challenges facing people living with rare diseases as one of those large, really public health issues, but also issues that span way beyond health in terms of the other areas of that are instrumental to fulfilling the Sustainable Development Goals. Next. So this is also the insertion of rare diseases into the disability agenda, and it's worked both ways. We have helped to promote health as a right for persons living with rare disabilities, but also then the inclusion, because many of our rare diseases do in fact result in both physical and other kinds of cognitive disabilities. And again, we need to be part of that global, larger initiative in terms of people oftentimes are not even included when there are disability policies because the numbers are small, because the disease may not be recognized in policies that are sometimes specifically written for the major disability areas. Next slide, please. Embedding rare diseases and non-communicable diseases. This has been a huge, I think, initiative that is also been coming to fruition over this past year, where the non-communicable diseases in the past have been looking mainly at 2 things, prevention, and also at the 5 major diseases, including cancer, diabetes, respiratory diseases, cardiovascular diseases, and are put to make sure that rare diseases are actually included as a large priority within the non-communicable diseases. You know, globally, there are more people living with rare diseases than there are people living with cancer, more people living with rare diseases that are living with cardiovascular diseases. So collectively, rare diseases are a huge, represent a huge numbers, but also, of course, a huge public health issue. I think as we recognize, just because you don't identify it does not mean doesn't have an impact, and an impact right through the economy and through the social fabric as well as health. Next slide, please. And this is where kind of like the end is that we're calling on this year for the United Nations to have a resolution to address the challenge of persons living with rare diseases. This will be the first time that we're trying to get the UN to explicitly recognize rare diseases as a population. We're hoping to introduce this resolution in the General Assembly this fall. We've been trying to bring together the support for it. As you can see, we have a core group of member states that are involved. We have others that have actually expressed their support for it. It would be amazing if India were to consider how it could support this resolution. We will be hosting a workshop on this as part of our Rare Disease Day celebrations on the 4th of March, this coming week. And we would really encourage you, if you can, to join us and to understand why we feel having a UN resolution to address rare diseases would be beneficial for all countries.
There's a lot of activities, including the peace protest, where all the parents came together and we created a lot of media awareness and tried to reach our voice to the government. And also, parallelly, in 2015, a PIL was filed on behalf of LSTSS. Then there was an interim order in 2015, and in 2016, the first 1 crore.
Next, I think this is it. Oh, this just then talked about where we are with that resolution. Next slide, please. That's it. Thank you very, very much.
Thank you, Ms. Darhan. Apologies for the technological interruptions, but it was a very insightful presentation on all the global movements and efforts going in around rare diseases. Dr. Madan Gopal, do we have any questions? Can I request all the speakers for this session to please put their videos on?
Very interesting and elaborative presentation. She has mentioned about the various initiatives being taken, but one of the highlights which she has mentioned is getting the rare disease into the agenda of UN. That's a very primemost thing, because if you are into the advocacy, the moment this step is clear, that means all the rest of the things will fall in line. That's the first agenda. That means she has highlighted about the UN resolution. She has highlighted about embedding the rare diseases in the NCDs. These are very important aspects. Apart from that, including and institutionalizing the rare disease as a part of SDG goals. So all the people, all the partners, they should work towards this direction. That's a directional thing which you have mentioned, apart from the other initiatives. Now we can hear the Dr. Sridhar, what are the research and how they are bringing in the research and other things. Please, Dr. Sridhar.
Yeah, thank you, sir. Thank you. I want to share my slide. Yeah. I hope it's visible to everybody. Can somebody just respond if it's visible?
Yes, it is visible.
Great. So I'm going to come into this context of rare genetic diseases from a very, very different angle of research and development. But before I go ahead, let me thank the speakers for putting together this wonderful session and meeting, all over an online platform, and fantastic organization, I should compliment. So talking about how does genomics impact rare genetic disease, that's going to be my driving theme. And as you can see the institute at the background of my slide, if you are in Delhi, anytime, feel free to stop by. Would be happy to host you. In genomics, when we study the science of DNA, which is present in all the cells, you immediately notice that it's all about me and the person sitting next to me or the person sitting next to you, because people differ by a very finite number of data points or DNA chemical molecules. Okay, capturing this small difference. So, for example, two people differ by only a 0.1% in terms of the DNA. So, capturing this difference would become the essence of understanding why two people respond differently to drugs, why two people have different diseases. So, could we use this for driving rare genetic disease is the question that we asked ourselves about a decade ago. And at the same time, we have this new specialty called genomic medicine, which is a medical discipline that uses genomic information to about an individual's part of comprehensive healthcare supervision. So this is a very evolving definition, But if you could use this to drive rare disease was the challenge. But for that, first we needed to understand how do you go about doing this science. So about just over a decade ago, myself and my colleague, Dr. Vinod Skaria at IGIB, set about laying the foundations for personalized and precision medicine in India by sequencing the first human genome in this part of the world, in Southeast Asia. And as of date, we have quite a footprint in Southeast Asia, right from sequencing India's first personal genomes, the Sri Lankan genomes, the Malaysians, partnering with our colleagues at Philippines and Middle East. We have put together quite a sizable number of genomes. Now, what are the major impacts or significance of putting together such a very nice resource? Is one of the immediate impacts would be in the area of rare genetic diseases, where about 70 million people in India suffer from rare genetic disease. So what is rare is not rare in India, primarily because of the sheer size of our population. So like it was alluded to by the speakers before me and during the opening sessions, how could you bring about general awareness, affordable diagnosis, understanding what is the mutation spectrum in this part of the world, which is very different from the Caucasian or the African part of the world, and could we end the diagnostic odyssey? Right now, it takes an average about 7 years to diagnosis. Could you do that in the first year of life? That's the challenge that we were faced with. And in order to address this, what Vinod and myself did at IGIB was to put together this research consortium. It's not a clinical service, it's a research collaboration called Genomics for Understanding Rare Disease India Alliance Network, wherein clinicians, patient groups participate to sequencing parts or the whole genomes, trying to understand mutation spectrum and help them going back to the clinician and counseling family groups. In case it's a new mutation, we would go about doing experiments to understand them. This is a pretty large consortium, about 280 collaborators, making one of the largest rare disease genomics consortiums in our part of the world and impacting a sizable number of family members. And it's an open-ended collaboration. There's not much of a legality around it. It's just purely on the principles of trust and equitable distribution of credits. So I'm going to take only one real-life example of how this consortium helps and operates and its impact. So I'm going to talk about primary immunodeficiency disorders because I did see in the scribble wall a lot of people talking about primary immunodeficiency disorders. Like this audience very well knows that it's a Mendelian disorder where the immune system is compromised to effectively eradicate disease-causing pathogens. And about 6 million people are globally affected by PIDs. And what we did along with Dr. Geeta Govindaraj at Government Medical College in Kozhikode, Kerala, which is a state in the southern part of our country, is to put a program mainly involving three major disciplines: immunodeficiency, autoinflammation, and autoimmunity. And the slide here shows the number of patients that we could recruit for each of these disease classes. And we applied genomics to this cohort of about 297 families. We could get a diagnostic yield of about 63%, and that by research parlance in genomics is a pretty high standards. Okay, that means for 60% of the individuals who came in, we could have a mutation or a molecular diagnosis that we could return back. We could have evidence-based genetic testing, build local capacities, and that's something that we are passionate about giving back because genomics is still a very expensive proposition for a country like India. But if you could convert that into affordable diagnosis on Sanger capillary sequences, it now becomes affordable to individual patients. It's going from a few thousands of US dollars to coming down to maybe 20 to 30 US dollars per assay. And that is something that we are doing very actively. Of course, education and awareness is something that we always do. And as you can see, a number of families with a number of diseases have benefited at the Government Medical College at Kozhikode. But the most important slide is this: what did it translate to in terms of a clinical impact? As you can see here, about 32 families could, or patients in families could be put on intravenous immunoglobulins out of which 14 went on to undergo a stem cell therapy. All this happened because we had a molecular diagnosis to begin with. And that's the fundamental development, or the stepping stone rather, I would say, that led to the stem cell therapies. We could also help 7 families undergo prenatal screening, thereby preventing the disease in the next generation. That's the kind of clinical impact that we hope to solve. And now we keep on doing this for almost a dozen such large cohorts that we maintain around the country. Today, with the help of the government of Kerala, and in the starting, Dr. Madan really mentioned, health is a state subject. So it's very important to involve the state governments. Here, with the help of the government of Kerala, we could set up a weekly clinic where the patients come, undergo counseling, have their genetic diagnosis done, all on an affordable basis. And of course, when they are detected, they go through the government funds for their immunoglobulin therapies, as well as their stem cell therapies. So end-to-end program, and that's something is very heartening, and to notice that patients do get benefit, and you involve all stakeholders in the system. We not only do that, we also try to understand what is the spectrum of the disease burden in our country in terms of rare genetic disease. We don't have an absolute number. We still, in many cases, use global numbers. So what we ended up doing over the last year and a half is to sequence 1,000 individuals, self-declared healthy individuals, trying to understand the baseline genetic makeup, use that to drive affordable and accessible genetic tests in India through help of industries, so that it can be scaled up into massive numbers. And all this is available in the public domain now. What we discovered in this process was about 18 million novel variants that are exclusively found only to our part of the subcontinent in the world. So identifying such unique novel variants will help in resolving allele frequencies for rare genetic diseases, and that's a very fundamental piece of evidence that is required, and helps genetic epidemiology of diseases in the Indian population. It's freely available to academic individuals on the link provided at the bottom of the screen. So what do you propose to do is to use genomics to drive carrier screening in the 10, identify what sort of populations and who in the population carries this genetic disease. That means they could be put on a counseling. We could drive pharmacogenomics, HLA typing, incidental findings. So we have close to about a dozen such applications that we want to use genomics to translate it into clinical utility. We also run a lot of education programs, such as the one funded by an unrestricted grant from Sanofi Genzyme called the CSR Sanofi Genzyme Fellowships for Medical Professionals, and more recently, the Genomic Variant Analysis and Clinical Interpretations 12-week course, which is open online course for both clinicians as well as life science specialists. We have over 1,000 individuals across the world who are actively participating. We are about week 10 in this 12-week course. We hope to continue this over the next few years. So in a nutshell, what do? We look at populations, identify prevalences, estimate numbers, founder effects. We use that to drive rare genetic diseases. We also do clinical education and training with the help of our partners such as Sanofi Genzyme. We also provide free of cost about 130 high-end genetic tests in our institute. And whenever opportunity arises, we try to partner with industry partners, as you can see at the far end of the spectrum, trying to translate these into products so that they can be scaled up not only to India, but also to the large population of Indian originated people across the global spectrum, which is very quickly turning on to be a sizable proportion of the world population. And of course, use this to keep driving our research and drug discovery programs. I'm going to stop there and acknowledge a lot of people who have fantastic scientists and students at IGIB, clinical partners, collaborating families and patient groups. Of course, fantastic support and sustained support by Government of India through the Council of Scientific and Industrial Research over the last decade and a half to realize this dream of genomics for rare genetic disease. I'm going to stop there and turn it back to my chair. Thank you.
Okay, thank you, Dr. Sridhar. Let me take 1 minute to sum up because we have already overshooted the time. So we have talked about access, we have talked about advocacy, we have talked about capacity building. One of the important aspects which you have brought, which Dr. Sridhar has brought, is early diagnosis. That means how to reduce the odyssey of diagnostic from 7 years to 1 year, less than 1 year. Here comes the role of the capacity building right at the medical college level. In the clinic, in the clinical practice, now the clinical practice and other things is reducing, but in the clinics, how to have a higher degree of suspicion to suspect a disease so that this genomics and other things, the person can be subjected to that. That higher level of suspicion will lead to clinical diagnosis, and you can at least reduce the clinical odyssey for diagnosing. That's one thing. Second thing is genomics is good, but how to make it affordable? That's important challenge which we are having with the state governments and the other partners. They have to come forward with that. The other aspect which is coming from this discussion is the methods which Taekwondo has done and which we have to push to make it more an agenda. If the rare diseases are to take a real policy discussion, they have to come into the policy discussion, then it has to be passed as a resolution at one of the either the UN level or it can be part of the SDG goals. The people has to come together and they have to push towards it. Then only people will start thinking about this and we can progress towards that. Over to you, Dr. Mahapatra.
Thank you so much, Dr. Madan Gopal. I would also thank all the speakers for this session. We are into the break. So the next session starts in 2 minutes from now. But we can just quickly we have 2 audience questions, just one line. If you could just react to that. First to Ms. Darhen. We got a question that do you have any special plan for India in terms of advocacy, diagnosis, awareness, and treatment?
I have major plans for India. India has to be my favorite country in the world to visit. So anything that we could do in India would be important. But beyond that, of course, India is one of the most important countries. And we do know because you have, I think as we've just heard now, a lot of the unique variations that are not found elsewhere, but you have huge capacity, everything from, research, drug development, to having systems that can get to large numbers of people. So we see India as an amazing opportunity to really talk about what are the ways that we can address rare diseases. So we have lots of Indian patient organizations that are a member of our Asia Pacific group of Rare Disease International. And we would encourage also India coming into, for instance, IRDIC, the International Research Consortium, joining our global initiatives. We need to see more India, and we would be so grateful to have that opportunity. India is a very important part of this rare diseases.
Thank you so much for responding to that question. Already you have covered many aspects in your talk, also in the talks by other speakers. One quick question goes to Dr. Sridhar. How can we reduce costing and reach of screening program? In a minute, sir.
Yeah, good question. So like I showed you in my talk, genomics is an expensive proposition, but there does exist affordable technologies that can really bring down the cost. Once you identify the causative mutation, it's only going to cost you as less as $5 to $10 to get the assays running. And we have actually done that in a number of communities. So I think use genomics for research, but diagnosis, go for the lowest available technology that's out there and scalable. If you can apply this, I think it's not doing genome sequencing for everybody, but rather the diagnosis for everybody, genome sequencing for only key individuals.
Thank you. Thank you so much, Dr. Sridhar. Fantastic session. Really enjoyed listening to this. Thank you so much, Dr. Madan Gopal, for bringing in those policy insights. To Ms. Suzanne for Takeda's approach, to Ms. Darhen for the overall landscape of movements for rare diseases, international and also with focus on India, and Dr. Sridhar for discussing those genome-related activities going on and efforts in India. Thank you so much. Thank you. So,
Thank you.
Right. So we shall be dashing into the next session. We had a break scheduled, but it seems that we are done with that break now. So this is the next session, that is session 3 on setting priorities and the urgency on rare diseases. Again, 2 parallel tracks. Track 3, that is here in Conference Hall 1. We shall be discussing about mobilizing resources and sustainable funding mechanisms for treatment to the patients, research, and for rare disease program. Track 4, which is simultaneously on in Conference Hall 2, is on better infrastructure and improved capacity for early diagnosis, monitoring, education, and research. So I would request the speakers, the guests for track 3 to please switch on their videos. Yes. Do we have Dr. Yukti's video? Fantastic. I could see all the speakers. So this again will be a very insightful session, I'm very sure. Let me take this opportunity to introduce the moderator for this session, Dr. Vijayashree Yellappa, Fellow, Niti Ayog, Government of India, shall be moderating this session. So Madam shall be setting the tone for the session with her opening remarks of about 5 minutes. Then at the end, she'll be again summarizing the session, and any questions that may come up, she'll be taking that up. I'm also here in the backup. I'm also noting down the audience questions. Audience, please put your questions on the chat box. We are taking a note of that. If time permits, we'll take all of that. The first speaker is Ms. Yukti Bhargava, who is a Global Senior Access Strategy Leader, Rare Diseases, Roche. Then we have Mr. Abi Ogundel, CEO and Principal, Defined Impact Group. So 2 speakers. Over to you, Dr. Yellappa.
Thank you, Dr. Mahapatra, for this kind introduction. So I'm Vijayashree Yellappa. I serve as a fellow at NITI, and then I also work as a senior specialist at the research organization by name Health System Transformation Platform. It's indeed a great pleasure to be present here in this important event. So let me begin congratulating the People to People Health Foundation for organizing this Global Rare Disease Conference. As we know, there are more than 70 million people suffering from rare disease in India. And the central government has ramped up its effort to fight rare disease in the country. Earlier this month, the Ministry of Health and Family Welfare has revealed a draft national policy for rare diseases, and it's inviting comments, suggestions from the stakeholders. I believe this conference has been organized aptly, considering this policy backdrop, very timely. So in order to find solutions for challenges related to these rare diseases, it is prudent that the public and the private health sector should make a concerted efforts and come together in a collaborative way. I also believe the diagnosis and treatment of rare diseases involves networking between research institutions, the biotechnology industries, and the policymakers. In fact, this whole gamut of stakeholders with emphasis on multidisciplinary research as well. So to operationalize this vision, what we heard through the keynote speakers, I think there is a need for advanced specialized training and adequate funding with the collaborations. Today we have 2 eminent speakers, Ms. Yukti Bhargava and Abe Ogunvel, who are going to touch upon the topic on how do we mobilize resources and sustainable funding mechanism for managing rare diseases and research programs. I invite Ms. Yukti Bhargava, to make the presentation, please.
Thank you, Dr. Yalappa. And just a quick heads up if you're able to hear me well.
Yes, we are able to hear you, Yukti. Yeah.
Thank you. Yeah. So thank you. My name is Yukti, and I've been working at Roche for the past several years now in the field of rare diseases. And I have to say, I'm so honored to be part of this conversation and this absolutely amazing path that my country is now embarking on in the field of rare diseases. The entire session so far has nothing short, but just absolutely inspiring and motivating. And this is exactly what we need in the research and development side, in the pharma side, to keep ourselves going and working for the best. So thank you so much for this invitation. If we just move on to the next slide. Yeah, so like I said, and inspiration and motivation is by, especially when we hear stories from the patients across the world, stories of hope that we hear from around the world, is at the heart of what we do. That's at the heart of the innovation that we aim to strive for. For us, groundbreaking science is meaningful only when it reaches the patients who need it the most. Innovation does not end with successful drug development. It goes much beyond that. It is the ability to understand how can we make lives of patients better. Innovation touches on all aspects of healthcare challenges, right from setting the local context, something that we have been discussing since the beginning of this conference, and so many speakers have shared their opinion on, right from setting the local context to moving on, discussing about early diagnosis, capacity, education, and most importantly, equity. At the heart of it all lies the partnership with the community that we fully believe and trust in. And community for us is stakeholders with diversity of skills, diversity of capabilities, such that we can, while developing ideas and while talking about solutions, we can truly make use of that diversity. I do want to stress upon one thing, because I know in this session we are discussing about sustainability of funding programs. What we have seen through our work across the world, working with multiple patient organizations, governments, healthcare systems, different countries, is that there are several pillars, in fact, to a sustainable healthcare system, and funding is one of them. In the entire rare disease ecosystem, we have to ensure that we are addressing early diagnosis, capacity, education, awareness, innovative funding and financing to ensure that the community can truly benefit from the innovation that we want to bring. I can talk about a few examples of progress from around the world, hoping that it would inspire some of the audience here today with us. And some of these things have already been touched upon. For example, partnerships in the APEC region have been discussed, I know, in detail. And those partnerships have been set up where the goal is to improve sustainability by improving the economic and social inclusion of those affected by rare diseases. We are aware that in Brazil, UNICEF is leading a multi-stakeholder local project to support management and care of children with rare diseases to address sustainability and tackle gaps on education and awareness. We also know from our work with patient organizations like Cure SMA, SMA Europe, that these international patient organizations are doing a lot of work through partnerships in the area of newborn screening, early diagnosis, and prevention. We at Roche, we are always exploring opportunities to be part of industry consortiums. And one of these industry consortiums that we are actually supporting is our partnership with Innovative Medicines Initiative, where we are looking to advance solutions to rare diseases that affect children and adolescents. The key goal over here is to understand how can we shorten the path to rare disease diagnosis by using newborn genetic screening and digital technologies. There are many countries in the world that are trying to solve for the challenge of funding and financing. Trust me, India is not the only one. And in understanding what this really means for the countries in their local context. As more innovation is entering the healthcare systems, countries are aiming to address the challenge of funding and financing by experimenting by engaging with the patients and the industry. Some of the inspiring examples we have seen from across the world are innovation in resource mobilization, like pooling of public-private resources, developing pooling alliances, sales-linked donations, fundraising partnerships, combining donations and government-matched contribution to support citizens with rare diseases who require treatment with high-cost medicines. And some of these examples have actually come to life in countries like Singapore, Chile, Argentina, Portugal, just to name a few. At the end, I would like to say that at Roche, we continue to collaborate across healthcare systems to explore new funding solutions that provide sustainable access. At the center of each solution is creativity and close collaboration between diverse stakeholders, including government and public authorities, private payers, government, non-governmental organizations. We continue to seek to partner across the rare disease community to have a better understanding of countries' local rare disease funding landscape and support the development of funding solutions tailored to the local needs. I cannot emphasize more the need, the power of the international community over here. And specifically in the area of rare diseases, the community is absolutely and fantastically interconnected. And there are so many opportunities, and we just heard from Ms. Durham pretty much talk about that. There's so many opportunities where we can learn from each other, because the path that India is embarking upon now has been trudged along by so many others. And it is for us to understand where those opportunities lie, to continue those conversations, to reach out and ensure that we are able to address the issues that are important for us and for our citizens. I would like to end over here, so that'll be my last slide, and very happy to continue this conversation in this session, but also after that.
Madam, please unmute yourself.
Okay. Thank you, Yukti. Thank you for this wonderful insights. Can I invite Abe Ogunvale for the presentation, please?
Okay, thank you. Thank you for having me here today. Please, can you confirm if you can hear me loud and clear?
Yes, you are clear. Please go ahead.
Okay. I'm not sure if I should share my slides because I made some tweaks to it. So should I share my screen? Is that better?
Yes, please.
Okay. Oh, great. I'm trying to make sure I don't repeat what we've heard. Oh, okay. So thank you again for having me here today. My name is Abe Ogunvale. I'm with the Defined Impact Group, and I will be supporting the flow of the discussion by touching on two areas. One is to give additional examples of potential collaborators. I know that Mrs. Susan and Ms. Dawn, as well as Yukti, they really touched upon most of the frameworks, but I would like to see.
Mr. Abe,
Yes.
Can I request you to play the presentation, the full screen, please?
The full screen, okay. Like this?
Yeah.
Oh, okay, great. Yeah, so I'll be going straight into it, but my goal is to add a little bit on top of what has been shared earlier so that people can have a very good grasp of the full picture. So based on what we've heard so far, and most recently with Ms. Yukti, you can see that the ecosystem of the collaborators and also the partnerships, whether at the regional stage or the global stage, based on what Ms. Susan and Ms. Dawn shared, demonstrates that there's a need for a global stakeholder and multi-country platforms to drive lessons learned when it comes to rare disease or rare disorder movement or campaigns. I believe that most of the collaborators and actors will definitely fall into some of the categories that we are talking about today. There are the research groups or the academic groups, the technical groups, which can take any kind of form. They could be private or even public or even individuals. So I see that having a multi-stakeholder platform is needed at the country level, regional level, and global level to really drive success. Number 6 here talks about the patient and family organizations or advocacy groups. One of the videos we listened to earlier did mention that sharing lessons between patients and also families or even advocacy groups is key to to achieving success in terms of rare disease movement, or even having a platform to address it at the country level. And definitely government, whether national or subnational levels, do play a very, very critical role. I like this perspective because regardless of what the interaction of an individual or a group or an entity is or a government is, there's always several areas of partnerships or collaboration that they can fit in, whether it's media, strategic, technical, research, academic, whatever. So it's a promising ecosystem that I believe will help increase partnerships and sustainable funding. These are some of the examples that I was just able to pull. At first, I wanted to give 5. Then I said, okay, there are so many, maybe I should make it 10. But the goal is not to list all, but the goal is to pay attention to the logic of these types of collaborators. You would see that they are foundations. Some of them are research-based. Some are institutes that are very specific to certain areas. Some of them are actually international already. They're already global, and they're still active, probably selective of countries or regions. But it shows that there are different layers and the different methods or methodologies to be a potential collaborator. So this is just for the Americas, and we have some in Europe that are also forming the same type of alliances. Some of them, they are country-based, some are multi-country, especially the academic institutions. You would see that they kind of cut across several continents, probably because of South-South collaborations and things like that. So again, this presents a lot of opportunity for India to tap into. I did have examples of maybe even in Asia as well as in UK, try to separate it from Europe. And we can always provide all this information to people foundation in India, so they can share with the audience. Lastly, on examples of active collaborators, this one really talks about India. I purposely made it very long to show that there's already a lot of activity going on in India. If one does not put a structure in place like we are doing on this conference, we may not really pay attention. But if you look at this, there's so many small groups across different ecosystem platforms that are already putting themselves together, right? You can see some just focusing on different courses or things that really speak to their mission, and it's called. Some of them are membership based as well, while some are very, very specific to hospitals or foundations. And we can see that it's just the right time to pull this conference together and have the government on board, have the private sector on board, and then push it. Having this much shows that people are ready for a more unified platform to kind of push the agenda forward. And I think it's an opportunity. The second part of my presentation, sorry, I'm kind of trying to rush, not trying to repeat anything that we've heard before, but some recommendations that I think will be very, very specific to the context of India. I think it would be nice if you talk about that. We've heard so much about what the United Nations is doing and how groups like Takeda are really pushing on a global scale. But let's even bring it down to the context of India, since that is that'll be be the win theme for us here today. So there are four main areas that typically countries go through to pull in sustainable funding mechanisms when a national policy is being developed, like for the rare disorder in India. The top three have to do with government really steps in. So I'm not going to make them the focus, but I still want to put them here because they're very, very important. That's general taxation and, the mandatory insurance, voluntary insurance. But the fourth one, which is the innovative and also creative financing mechanism, will be my focus. Very aligned with what my co-speaker, Ms. Yukti, mentioned about innovative financing. So under this innovative financing, there are also few elements that have proven to be very successful in many countries, as well as for other disease areas that do not have a national or global strategy, like maybe HIV or TB or even some NCDs. So we can see elements of creatively working through having special levies on companies. India is very unique in terms of private sector participation. It's actually the envy of almost all countries, and I think that is one area where people tend to look to engage in the very first one, which is having levies on some private sector companies in a very collaborative way. Then also levies on currency transactions. This happens a lot in continents where there's a lot of remittance from foreign exchange transactions. This is a very, very good place. Also collaborations with the financial institutions comes to play in this place. The third one that is becoming very popular now is the bonds. You see, people in the diaspora, they tend to always look for what to do back home. And this is because they are still engaged many times, if not directly engaged with their base. They are engaged when it comes to natural disasters or humanitarian assistance, or even just making sure that there's proper upkeep for families back home. So many governments are definitely turned into government bonds to citizens living abroad as a way of contributing if you don't want to do heavy investment. So that is another very innovative way and creative way. It requires collaboration and then start small but scale up in future. And then the last one will be the ones that we are getting to see more of these days, which is having transaction tax, especially through cell phones or even alcohol consumptions. So these are the ones that we see that have had good successes in many countries. And India is also definitely a very, very good example of. I'm sure some of these are already in place, but again, red disorder movements and platforms can also enjoy and benefit from this. So this last slide really talks a lot about the opportunities that we can use to attract private investment and private collaboration, looking at the context of India. And that's because India is unique, again, when it comes to private sector engagement. And I think these 5 points can really speak to it. Looking at the landscape right now and looking at the way the global rare disease movement is going and the expectation that India should please quickly come on. I do recommend that, creating a rare disease fund at the national level for treatment of those that have been diagnosed or waiting for a new type of medication, or just living through the disease will be key. It also sends a very good signal to those that are willing to volunteer or those that are willing to try and use their own resources to identify and come on board. So it's a very, very good call to action methodology when you just create that fund. Having, of course, an improved cost sharing model or structure with the pharma companies, which are also the private sector, they could be the telecoms or whatever, and the government. The modality can be discussed, but even starting that conversation is a lot of success. And many times things start small, and before you know it, if there's traction and better data sharing methodologies, you will see that it will quickly move forward. The third one, of course, is the government-run entities coming into collaboration with the private sector, um, um, so that their CSR funding can align towards the strategic goal that is focusing on rare diseases. Lastly, government can also assist with some of the funding the orphan drug. We did hear earlier about drug repurposing and all that. The government can actually take on some of this to start with. There could be a timeline, like was done in Chile. There was a timeline. They said, for the first 3 years, these are the things we will do, but we needed to organize ourselves to take it forward. So those are some of the areas that this can be done. And lastly, government and industry, pharma in this case, there can be some forms of subsidies that can be discussed. And I think this approach will not be new to the context of India. I think that is all. So please ask me questions if there are any, and I'll be happy to answer. Thank you.
Excellent. Excellent insights, both from Yukti and Abe. I have 2 questions, and maybe after that I can take some questions from the audience. I'm particularly appreciated your perspective on innovating financing mechanisms, which I personally believe is the key for strengthening the management of rare diseases. So Abe, I have 2 questions for you. So one is, can you give us examples of potential collaborators and the global funding sources to support the treatment and the research programs? And also, I really appreciate your perspective on creating a board at national level, which would lead to call to action. But that would require a wide multi-sector collaborations too. It would be helpful for us to, if you can give us an example of a neighboring countries, how did they go about it? And the second question is on your sustainable funding mechanisms. As you know, India has a mixed health system, and the private sector is very dominant in the provision of healthcare. I'm very glad that you have pointed out some of the opportunities for utilizing the private sector resources. You did specifically mention about cost sharing of 30-70%. I would request if you could elaborate on this aspect. Over to you, Abe.
Can you hear me?
Yes, we can hear you.
Oh, okay. So the first one, based on the example of global, yes, I believe that at this time, the bulk of global types of funding is still taking the shape of research. That's what I see, because I've come to realize that in many countries, collaborations at times do not necessarily have to be in terms of funding. So there's the financial collaboration as well as the non-financial financial collaborations. There are many research institutes that fund research-based projects, and they end up becoming potential technical partners or strategic partners. So many times it may not be direct, like request for a proposal or request for memorandum of understanding with a nation as a whole, but you could see a lot of research activities going on, or even a form of adversary, or even very high level collaboration that is taking place that is not on that is not seen through the lens of a financial commitment. So I think those little types of engagement are also very key, and they're very, very important to the ecosystem that we described. Let's take, for example, the Rare Disease International that Dr. Durham mentioned. What they are doing right now with the United Nations to come up with a resolution. Those things are the enabling actions that will later on in the next 5 years or 10 years of a strategic plan or a national policy lead to funding. So again, everything just kind of comes together, but first, the funding is not, let me call it, it's more of a collaboration to start with before the funding now comes after that. So that's what I think it is. I'm not sure if Dr. Yukti may have other innovative financing ideas, but I've seen the trend of many countries starting with the collaboration first, which is most of the time a commitment that is non-financial. Then with time, once there's a resolution, maybe with the UN or with the World Bank or with the research entities coming up with results of the research, then the funding now starts to follow immediately.
Very nice perspective, Abe. Thank you. Yukti, do you have something to add on this particular point on the innovating financing?
Abby has very nicely summed it, but I can share a few perspectives, especially that now we're learning so much from what some of these other countries are doing, and pretty much in a stepwise manner, because I think that innovative funding and financing in a way that it guarantees sustainability and affordability is not an easy question to answer. And it is very, very, very important to localize this context. What does it mean for our people? What does it mean to our budgets? How can we define rare diseases? What does the epidemiology look like? So these are very, very fundamental questions that we have to spend time answering in a collaborative way. We have to ensure that patients are at the center of these discussions. We have to understand what it means for them. But then also going beyond this theory, because we can have a policy with a fantastic action plan and strategy, but when the rubber hits the road, it's the implementation. And then in a country like India, I think our biggest challenge is when it comes to implementation, because we're not talking about 1 million or 2 million people living with rare diseases here. You have to understand how states would want to deal with these subjects, so with these topics. So things like setting up a digital platform or registries, ensuring that locally the subjects are being prioritized at the state government level is important as well. And some of the other countries like Sweden, for example, like much smaller in size, it's easier to manage. But for us, the journey, it just has, the collaboration in itself is going to take time, and we have to acknowledge this as well. Working with industry, I've seen most of our health systems partners cannot emphasize enough how important it is to work with industry also, just because we can bring that perspective, not just the drugs to the market, but also the voice of the patient in a very structured manner to understand what these solutions can really do. And we have a role to play over here. We have a role to sort of understand how we can contribute to these solutions meaningfully. So in a country like India, I would say it's a stepwise process, and I'm glad to see that we've already started these conversations. It's the implementation that will be our sort of test, and how we can do it. How we can do it in a way that people can truly benefit from these conversations.
Yeah, thanks, Yukti. I have a follow-up question on the same thing. What I believe is that caretakers play a critical role in the care support and management of the rare diseases. And I would like to allude to Dr. Sarwal's keynote message, where he called us to have a blog where caretakers and the patients can share their experience. This also involves creating a lot of awareness in the community. Do you have any suggestions for India or any of the developing countries on the modalities for engaging the community in the rare disease management?
Yeah, absolutely. And you know, for us, the engagement with the community pretty much begins when we are even thinking about a clinical trial. That's where the engagement really begins. And and this is what my urge would be, or my suggestion would be, for us to consider how can we leverage the power of the patients and caregivers in India to understand the clinical development process for them, with them. How can we engage with them in a meaningful way? How can we design outcomes that matter most to them? So for us, engagements with the community start at that level. And we are already doing a lot of work globally to ensure that we come up with clinical trials that are relevant. We come up with patient outcomes or endpoints that are relevant, that are meaningful. What we have also seen is in some of the countries like the UK or Australia or Canada, where they have developed rare disease policies, and all of these developments are pretty much 2 decades old, right? From 2000 up until now. This is recent work, and it is really inspiring to see how some of these governments are thinking about various tools to ensure that while they are developing their policy, they are speaking very, very transparently with the community. And there are various modalities they have applied. You know, it could be simple things like a survey to ensure that the caregivers or patients are present at the table, or things like the conference where Dr. Mahapatra is constantly asking for audience to put their thoughts on the scribble wall. I mean, these are very powerful tools, because you know we have this opportunity of reaching out to so many people out there, and this is pretty much what is happening in some of the other countries around us.
Thank you. Dr. Mahapatra, can I pose another one question and then I'll wind it off?
Yes, madam, please.
Yukti, I'm very delighted to see one of your slide which mentions health system capacity for screening and treatment, which I believe is an important component for early detection and management of the rare diseases. How do you foresee this kind of activity getting integrated into the general health system programs, especially in a country like India, where private sector is so dominant in this health service provision? Do you have any examples from any of the countries where private sector plays a major role?
Absolutely. And like I mentioned in one of the slides, we're always seeking to understand how can industry consortiums come together under the leadership of governmental or non-governmental organizations to ensure that we are able to come up with solutions. One of the consortiums that is quite active in Europe, something we can learn from, because India is so unique. I don't think there'll be any solution out there that we can simply just adapt. But definitely there are several solutions out there that can inspire us. And you know, that's why the example that I want to share over here is the Innovative Medicines Initiative, IMI, which is one of which is one of the organizations in Europe that leads forms these industry consortiums to come together to identify. Together we identify a goal, an unmet need, and very transparently we work through the project as part of the project to understand and implement solutions. There are few, and one of these consortiums that is currently, one of the goals that is being discussed is pretty much in the field of newborn screening. Because here, the world is struggling with the similar problems that we are. Despite our situations being quite different, we are struggling with similar problems. Scalability of data, interoperability. how do we use advanced learning, or how do we use algorithms, how do we use digital platforms to ensure that we are able to achieve efficiency, but also decode some of the complexities that are associated with the nature of the rare disease anyway. And some of these things were discussed by Dr. Sridhara in the session before. So these are some of the consortiums that are coming into play in Europe, for example. And how can we learn from them? How can we understand how registries are being set up, or how different registries can speak to each other, especially when different countries have such different legal frameworks to deal with. So all of these questions are being discussed, and we can take a lot of inspiration from these examples.
Thank you. Thank you for a wonderful perspective. And it was such an honor and a pleasure to moderate this session. Dr. Mohapatra, if you have any questions, additional questions from audience, please, you take it, and over to you.
Yeah, thank you so much, Dr. Yellappa. Thank you so much, Ms. Yukti, Dr. Abby. That was a very nice, thought-provoking discussion. We had one question, but then that has already been covered in one of the questions that you posed to Ms. Yukti. So that's already covered. Since this is a session on research and on prioritization, and I being a researcher, I'd like to make a point here that I've seen, like, been through all the sessions in build up to this global conference. I feel that even as research and development is being prioritized, we are calling for public health action. So we also need to put some focus into public health research, not just epidemiological, but broader socio-behavioral research using different study designs which are beyond usual conventional laboratories or hospital wards. That will enable us in making very appealing policy pitch. The complexity is that we do not have many researchers in this domain, in community medicine or public health, who are committed to this kind of a research. Maybe we do not know where exactly we can start. Whether do we start at the mentorship level, or we provide some 3 to 5 year grants so that they can build a career on it. Very small grants do not help in sustaining a career. So maybe some medium-term grant or fellowship, something of that sort can be taken up. But overall, thank you so much, Dr. Yellappa, Ms. Yukti, Dr. Abby. It's been very interesting. Thank you. Let's conclude this session. We have all the audience converging on Conference Hall 1 in 2 minutes. So we can take 2 minutes break. Thanks again. Thank you.
Thank you.
Thank you.
Have a nice evening.
So we shall all be starting with the final session of the day in just 2 minutes from now. That's 8:55 Indian Standard Time. I know, apologies. We are broadcasting all over the world. We really do not know what time zones you are in, but in just about now, a minute from now, we shall be starting with the final session of the day. Yes, I could see Dr. Amandeep Kaur Khan's video, Dr. Tanushree Mandal's video. Welcome, madams, for this session. We shall be starting in about 30 seconds from now.
Thank you. Dr. Mahapatra, if you help me with one thing, I have shared my PPT and as well as PDF to the organizers. So is it available to you? Has it come towards you?
Yes, it is available with the backing team. So if you want them to project, they can project it.
Yeah, it's better if you can project from your side.
Sure. That'll be done.
Thank you.
Right. So we are here. I request the backend team to turn on the session. Yeah, please stop projecting that slide.
Okay.
Fantastic. So we are here in the next session where we shall be getting some highlights of all the consultations that have happened from the regional initiatives. So the regional consultations would be summarized, and thereafter, I could see that Dr. Rajendra Kumar has joined. So thank you, sir, for joining in. So we shall request your words of wisdom. So let's get started here. We have Dr. Amandeep Kaur Kang, MD NHM Union Territory of Chandigarh, and I shall request Madam for her talk.
Yeah. Yeah, good evening to, I hope you can hear me. I'm audible?
Yes, madam. Madam, are you presenting the slides? So kindly put it on full screen mode.
Okay, fine.
Yes.
Right. Good evening to all the delegates and congratulations to the organizers. Rare diseases, they need urgent addressal in India, for which there is a need for time-sensitive action and coordination in the coordination of multidisciplinary stakeholders. The key challenges are lack of awareness about rare diseases in the community. There is inadequate knowledge and exposure among the healthcare professionals, including senior faculty. There is difficulty to adequately train the junior faculty, students, and health workers. Limited opportunities are there for diagnosis at the neonatal stage and genetic testing for family members. Availability and accessibility to treatment is inequitable, and many a times there is delay in the treatment and management for rare diseases, even if they are diagnosed. The medicines are costly and often unavailable. Most of the medications are imported and of limited domestic production. There is a huge emotional financial burden on the patients and their families, which is catastrophic. And there is a lack of sustainable funding mechanism through national policy for rare diseases in India. This is a huge challenge in our country because rare diseases are mostly, the treatment required is very costly, and there are limited number of centers of excellence in our country for rare diseases at the state level. Then going forward to creating, there is a need for creating awareness, and this is a need of the hour. There's a huge need to enrich the teaching curriculum and the clinical practices by including information on rare diseases and medical genetics and genetic counseling. Generate awareness among medical undergraduates, faculties, practitioners, PSUs, and corporates. We need to create ambassadors for rare diseases among the medical fraternity. We need to generate more evidence on rare monogenic, autosomal dominant recessive disorders and phenotype variants. We need to upskill therapeutic research in the niche areas of genetic transfer therapy, gene distribution technologies, and gene editing approaches. Build international reference networks so that nations can cross and co-learn in a comprehensive manner and enhance the implementation at the local levels. Experience sharing by patients, family members, patient support groups should be encouraged. They should be focused on the entire ecosystem. Intensify the efforts for early identification through screening at prenatal, neonatal, preconception levels. This will help in early diagnosis and treatment. Prenatal diagnosis and pre-implantation genetic testing are recommended. Population-specific issues like endogamy, consanguinity can be dealt by providing genetic counseling. We need to make services more accessible and equitable, and this has been observed in the states. There need to be a community-based approach for early diagnosis. A standardized treatment and risk management policy should be there. We need to increasing the awareness in the community and experience among the stakeholders and including the community. At state levels, definitive treatment is recommended, and approval of the medical and technical committees should be fast-tracked, and there should be a transparency in the system. And mechanism for globally available treatment for Indian patients should be there. We need to evolve the models of healthcare. There should be a center of excellence for rare diseases, come referral and training center nationally. Dedicated national treatment and care coordination centers should be there. At least one tertiary hospital in each state for diagnosis, treatment, and management of rare diseases. Hub and spoke models with a minimum 4 to 5 spoke hospitals in a state for regular care. Amplify the awareness among general public, commemorate the World Rare Disease Days every year, give it the same weightage in the public discourse. Rare disease national policy should be implemented and reviewed periodically along with the list of conditions included in the current National Registry for Rare Diseases. Rare diseases are not rare, but let us not make shared responsibility rare. And rare disease is a huge challenge in India for the affected individuals and families with extraordinary emotional and psychological and financial burden. Indian Rare Disease Registry initiative by ICMR is a welcome step. GOI proposals for financial support under Rashtriya Arogya Nidhi are another step forward, but much more needs to be done, as all of us have spoken today. Thank you.
Thank you, Dr. Kang, for bringing us insights from North India. India is a different turf altogether. Like the epidemiological requirement, the epidemiological situations, and the policy requirements are quite heterogeneous. So the consultations bring in sub-national priorities, and your talk highlighted issues that are very relevant for North India, not just North India, for rest of the country. So we need to be cognizant of the national priorities, also the regional priorities, to be very effective and be able to penetrate deeper into the problem resolutions. Thank you so much, Dr. Kang. Moving on. Thank you, madam. Moving on to our next speaker, Dr. Tanushree Mondal, Deputy Director, Medical Education, Government of West Bengal. And she shall bring us highlights from the consultation we had for Eastern region, as well as her own perspectives. Over to you, ma'am. Ma'am, can you please unmute yourself? You're muted.
Thank you, Dr. Atishman, for inviting me to this important conference, and I'm really delighted to be a part of it. So I was listening to my earlier speaker, and yes, there are so many salient points that she had highlighted. So I'll be talking about the recommendations that we have come along and through this journey. So let's move into the slides, what we have done till now. So I would like you to navigate to the slides, please. So this is, a journey of us. So we started on with the rare disease consultation in the month of December 2020. And we were talking about the indispensable role of the peer support groups in prioritizing the rare diseases. So amongst us, we had eminent speakers from many of the rare disease societies of India, like ODI, and then we had SMA, Pure SMA, as well as also we had from lysosomal storage disorders. So we picked up many salient points from there. So next, this journey was followed by the next slide, please. Yes. So as the slide shows that, we were all together in this fight, and we are all together in this fight. So it's not a solo fight. It's basically a fight. We are in the mission of, providing a good platform for the patients who are suffering from rare diseases to make things congenial for them. So yes, as I was talking that there were many partner organizations and also key stakeholders, as we can see. Among them were CureSMA and LSSDS and ODS, Muscular Dystrophy Patient Welfare Society. So the key notes that were taken from the consultation were about the definition of rare diseases. So many were not very comfortable with the definition of rare diseases, and moreover, people thought that there is a lag still between of the information and the education that is being imparted regarding this rare diseases, and a lot goes on the collaborative part. So it is a collaboration between the different stakeholders. What is more important is the funding. People talk about crowdfunding in case of rare diseases, but crowdfunding does not suffice the care, support, and treatment of rare diseases. So it needs a lot of attention and brainstorming on this very aspect. And yes, the photos of approach that were discussed on, that whom to approach, where to approach, when to approach. So that was very important in itself. Now, coming to the next slide that we can see is the achievement. So, following this consultation, there was a briefing on the East Region Rare Disease Consultation, and as you can see that we had many points that were being covered in such consultation. Next slide, please. Following this consultation in the month of December, we also had this rare disease consultation for North India that was organized in the month of January, followed by the one in southern region in the month of February. So we should give a lot of kudos to the organizers, especially PTHF, who had really taken this initiative to spread the word across the country. So that is really a good initiative in itself. Next slide, please. So this was not the ultimatum. So this was followed by a virtual roundtable discussion on the spinal muscular atrophy and the way forward. And this was held after the Eastern region consultation. And a lot of initiative was taken from this group itself. And we can find many eminent experts starting from those who are from the bureaucracy, those from the technocrats. So they all came together, and also the subject experts, they came together to discuss on the way forward to this disease. Next slide, please. So yes, I personally talked about establishing a multidisciplinary SMA clinic and the treatment center in government hospitals, especially the challenges as well as the solutions to it. And as my previous speaker in the other session was talking about the registry. So yes, registry is a big issue everywhere, and in case of rare disease especially. So we need to focus on this very important aspect. Next slide, please. So coming to this most important slide that I want to highlight is the sports. So what we have actually achieved over the years and where we need to go, what we have achieved till now and where do we want to go. So if you want to see, then the strengths are definitely the draft policy which has come in, and it has incorporated a whole lot of things that we had been brainstorming over the years. So it has classified the rare disease patients into various categories, and on also the basis about the treatment. We also find that the technical committees, they are being set up in various states, and in our state we would say that it is very proactive, and regular meetings are being organized with the involvement of all the key stakeholders involving the bureaucrats, the technocrats, the subject experts, the pharma companies, everyone, and also the representatives of the rare disease, the society. And there has been earmarking of the Center of Excellence, which is very important. And as I can recollect from one of the speakers who was talking in one of the sessions today, that it is not only important to identify the Center of Excellence all around India, but also to achieve the collaboration between all the Center of Excellence, so that they can work in tandem and they can, help this rare disease patient, achieve their goal of remaining active and also healthy in the process. We also have the Nidan project. So what happens is that it is working on the different rare disease aspects and also the coming of all the stakeholders. Now, among the weaknesses, I would not point it to be only the clinical trials only, as Dr. Achishman was also referring to his speech, that we need a whole lot of research that should be focus on the rare diseases. So we can involve a whole lot of community medicine experts also looking into the various aspects of these rare diseases in the future days to come. And yes, of course, the absence of a registry I would point out as to be a weakness. Now, in the coming thing for the opportunities, yes, of course, these consultations and meetings and conferences, they provide a platform to spread the word all around. And among the threats, I would say that the resistance from certain areas regarding the funding, that is a big threat to us. So we need to focus and we need to really work hard on this aspect. Next slide, please. So the recommendations would be in total the involvement of all the stakeholders, starting from the big corporates also. As we're talking about the funds, so we can fit in their corporate social responsibility funds also in here to help the rare disease patients. And regarding the commitment, we need to be very committed as well as accountable and timeliness of all the things, like including the implementation, the treatment, the care, and the support is very much required. So I want to wind up my session saying that someone who is rare, we need to care about them. And I really thank the organizers, and a special mention to PPHF, then Jitendra, and Vinod from Takeda, and a special mention to Megha and Tina from PPHF for allowing me to have a talk on this, and also Mr. Palo for inviting me to this panel. Thank you very much.
Thank you, Dr. Mondal. That again was a very nice SWOT analysis that you presented. Thank you also, Dr. Kang and Dr. Mondal, once again for this session. We have an apology from Dr. Arundhati Chandrasekhar, IAS, Mission Director, NHM, Department of Health and Family Welfare, Government of Karnataka. She would have attended this session and given her insights about the South India consultation, but due to some important issues, commitments, she could not join. So thank you so much, esteemed panelists for your insights and your talk. Thank you.
Thank you.
Now, we are really happy to have Shri Rajendra Kumar, Director, Prime Minister's Office, Government of India. So, sir is our guest of honor for the day. We could not have his talk earlier because he had to attend a vaccine launch session, which came in at short notice. So, without further delay, I request sir for his keynote address.
Thank you, Dr. Arkisman, distinguished guests, speakers, organizers. A very good evening to all of you. It is my privilege to address this august gathering on a subject which is very close to my heart. I have been looking after health as a subject for almost the past 3 years in this office, and at the outset, I deeply appreciate the efforts of the organizers and the partner organization for organizing a global rare disease conference. Friends, this will go a long way, not only in generating awareness about rare diseases, but also in consolidating the efforts to fight rare disorders. This will also consolidate the faith of those affected by rare diseases globally and give them a ray of hope for their suffering and despair. Friends, from the perspective of governments, public health professionals, medical practitioners, we may call these diseases as rare diseases because of their low prevalence, but for someone who's suffering from it, it is his universe. For him, it is 100% suffering. For that family which is supporting such individuals, it is their 100% suffering. And from their perspective, if we think from their perspective, the scenario from their perspective would look like they will find our health system as rudimentary, and as rudimentary as it would have been in medieval time. Our health financing as inadequate as it would have been in the medieval or ancient times, because they do not get anything out of the entire advancements of science and technology. Friends, different countries define rare disease differently. However, if we go by WHO, then rare disease is debilitating, lifelong disease and disorders, condition which is less than 1 per 1,000 population. In India, Government of India has first formulated a draft policy rather, for treatment of rare diseases in July 17. However, it was felt that there is a need for deeper dive, and accordingly an expert committee was constituted in November 18 to review the draft national policy for rare diseases. Based upon this draft national policy for treatment of rare disease was placed in public domain in January 2020. And I think this policy will go a long way in providing the treatment, diagnostic, and public health financing for rare diseases. As we know that globally there are 6,000 to 8,000 rare diseases are estimated. Out of that, in India there have been 450 rare diseases recorded. However, I believe that this number is the lower side of the estimation. It may be far more than this. And in this case also, the recent initiative of ICMR to start a rare disease registry will go a long way. In times to come, we'll have the pool of information available for both people suffering from it as well as the medical practitioners. As we know, the low number and the less prevalence of rare disease causes difficulty in collecting epidemiological data. This impedes the research and development of not only diagnostic but also the drugs. The lack of awareness amongst the general population and orientation of even the medical practitioners often at times causes delay in diagnosis and treatment. I think early diagnosis is the key to success to avoid morbidity as well as mortality. And early diagnosis is among the biggest challenge in case of rare diseases. There are equal challenges in treatments as well. In medical management, the availability and access to medicine is another important aspect, because we know that cost of medical treatment of rare disease is very high. So despite our advances in science, effective and safe treatment is not available for most of the rare diseases. Hence, even when correct diagnosis is there, the treatment remains a big challenge. 90 to 95% of rare diseases, as estimated, have no approved treatment protocol. And even for those disorders for which drugs are available, the treatment cost is often very prohibitive. We have been hearing such cases across media, they are reported globally. And if general estimates are taken into account, then the cost is always very prohibitive. The average costs are as high as $100,000 per patient and per treatment, though it varies from disease to disease, but it's almost high for almost all the diseases. Though it varies from country to country and community to community, but the costs are prohibitive across the globe. Many countries have started various initiatives, and I find that the initiative of, for example, Orphan Drug Act initiative of USA, which promotes drug manufacturers to encourage them to manufacture drugs for rare diseases, and similar steps should be started across other countries as well. I think such initiatives are required in our country as well. The expert group on rare disease in India has classified, which was headed by Dr. Paul, has largely grouped it into three types. One are for those which are amenable to curative treatment and one-time treatment. Another are which need long-term treatment and management, and rest of the disease. I think our strategy for treatment as well as diagnostics should also be evolve around these things, because certain diseases which can be cured by one-time treatment, the funding and financing has to be different. For some diseases for which would require a lifelong support, I think the support would require will also be differently, both medical management as well as, I think, financial support. These all aspects are dealt in detail in our draft national policy, and I think in times to come, this will go a long way as far as India's case and fight against the global disease is concerned. Friends, we have a vast network of tertiary care centers. We have almost more than 500 medical colleges and tertiary hospitals. We have a network of 750 district hospitals, and if we take the pool of private tertiary care centers, we have a large pool available. What is need of the day today is that the medical practitioners should be aware, proper orientation training modules should be there, because unless there is adequate awareness about these diseases, the treatment protocols, the early diagnostic facilities, it will be difficult, and there will be always delays. We have a vast network of health and wellness centers also, and we are planning to expand it, from present 50,000 to maybe 150,000 in times to come. India is a country which is providing universal health coverage and going towards that. We have the largest insurance program in the world, providing coverage to the extent of 500,000 Indian national rupees to 105 million families, which is one of the largest in the country. However, under Prime Minister Jan Arogya Yojana, though there is a network of more than 12,000 private hospitals also with this, but as far as the treatment of rare disease is concerned, it is limited to very few tertiary centers. So there is need to expand the network, there is need to expand the technical know-how, there is need to expand the medical capabilities as well. Beside this, Government of India has set up a special Arogya Nidhi. I think there was a discussion about Arogya Nidhi in various platforms. Presently, the amount is limited. However, the new policy which is proposed has proposed a higher quantum of assistance for such rare diseases. I think India is committed to provide health for all, and it has taken series of steps to ensure it. At the community level, I find a great kind of awareness now, and people are coming forward to help each other. Beside, just the government, I believe it is such novel initiatives of civil society, non-government organization, advocacy groups, and initiatives like crowdfunding, which will go a long way in our fight against the rare diseases. The need of the day is to pool resources, and at this point of time, when I say pool resources, is not only the pool of resources domestically available. There is a need as far as global resources are available. There should be, the knowledge should be shared, the scientific expertise globally available should be shared, the research and development in drugs and diagnostics, wherever it is available, it should be shared freely. I think as far as rare diseases are concerned, the communities should come forward, the countries should come forward, the scientific community should come forward and provide it easily available to all countries across the globe, so that the treatment cost can be reduced substantially. It is only if we pool up all resources available globally that we'll be able to fight it proactively, and the cost will be reduced, because cost is so prohibitive that at times when treatment is available, it becomes difficult for that family and that individual to support his treatment. One suggestion which I will conclude with this one suggestion is that the global community and countries should come together. If one thing the advocacy groups like this platform can do about it, the one advocacy I would suggest is, which is my individual capacity, I would suggest is that all governments across the globe should remove all kind of taxes and duties on drugs and diagnostics for rare disease. If that is done, it will reduce the cost substantially. Another initiative which I have seen of late is the crowdfunding. And the crowdfunding, because there will always be a limit on government and public funding on this. Even if we increase it substantially, there still be diseases. For example, if we talk about the new draft policy, which proposes that 15 lakh assistance to such diseases, even in that case, there will be many diseases which will go beyond the ambit of such assistance. and families and people will still suffer. So to that extent, I feel that initiative like crowdfunding would be a very novel and will go a long way. And for that thing, awareness generation, advocacy groups, civil society, uh, doctors, practitioners, and people should come together in this fight. With this, I'll conclude my remarks, and I'll again thank the organizer for giving me this opportunity to share my thoughts on the subject.
Thank you so much, sir. Despite your other commitments, you took out time to come and enlighten us on the information and the wisdom that you brought in. And you spoke about uh, different stakeholder constituencies. You started with making it more patient-centric. You said that epidemiological data may suggest that these are rare conditions, but for the individual, it means the universe. Then you gradually moved on and you highlighted issues of capacity, awareness, financing, and policy definitions, many issues you touched upon. And finally, you concluded with two very objective suggestions. The need to remove all duties and taxations on drugs and therapies for rare diseases, and also to make crowdfunding a more sustainable approach, because public financing shall always be inadequate. Thank you so much, sir. That was such a comprehensive talk. Thank you so much. Now, moving on to our next speaker, we have Professor Madhulika Kavra from the Division of Genetics, Department of Pediatrics, All India Institute of Medical Sciences, New Delhi. And I would request Madam to quickly, in 2-3 minutes, summarize the initiative's journey and then to release the call to action digital booklet. Over to you, Madam, for your quick inputs.
Okay, thank you. I'm really privileged to actually stop and thing.
Madam, we are getting much interruption. I would request you to switch off your video so that we save some bandwidth. Madam,
Okay,
please
right.
switch off your video.
So, yeah, I have done that. Is it okay? Am I audible
Yes,
now?
madam. Yes, madam, very much.
Okay, right. So, this Blueprint of Rare Diseases in India is a pioneering initiative designed as a multi-stakeholder initiative and collaboration focused on rare diseases in India. The initiative is foresighted and seeks to prioritize the needs of people suffering with rare diseases by bringing together diverse partners, discussing challenges, innovation, and strengthening the nation's commitment towards delivery of greater impetus and better outcomes for all. It is expected to generate dialogues, build synergies, bring forward a concrete and actionable comprehensive charter as an outcome, and reinforce commitment on it for the cause. Over the past 1.5-year journey, the initiative grew by multifolds and with multiple collaborators, including various state governments like Punjab, Chandigarh, Karnataka, and West Bengal, and even from outside India, like from Japan, and other associate partners, and Niti Aayog, who had which has also co-hosted the Global Rare Disease Conference. Rare disease pose unique challenges to society and healthcare systems because of the complexities it holds and the ever-changing nature. But what is required is not just talking about the problem, but find solutions. And that's what the idea behind this journey. And PPHF tried its level best to find out the problems and take some initiative towards finding solutions as well. After understanding the opportunities and limitations, initiatives were chalked out a plan of moving in a stepwise approach, starting from reviewing the draft national policy with key stakeholders and submitting the high level recommendations to the government, followed by various national and subnational consultations in partnership with multiple state governments to highlight the good work states are doing and learning from each other. And this wisdom was then compiled and ready to be amalgamated with the global lessons which we have acquired today. These will now be submitted to the government for creating the highest level of impact towards strengthening our country's rare disease framework. Initiative now has various public and private partners who are committed to work on supporting the rare disease programs moving forward. With this note, I would like to take this opportunity, and I'm really privileged to release the digital booklet that's a compilation of the recommendations that have come up from various national and subnational meetings under the initiative of PPHF. The booklet is a base document that will be built upon moving forward. The e-copy of the booklet shall be shared very soon. Thank you very much, and I would like to thank again PPHF for giving me this opportunity. And I'm sure with each one of us working together, all stakeholders working together, we will definitely do very good work, and we will provide very, very good care for the patients who have rare diseases and help the families as well. Thank you very much.
Thank you, Madam, for so nicely and quickly summarizing the initiative's journey, and also for releasing the booklet. I would like to congratulate all involved, all stakeholders, all speakers, all patrons for this booklet. It's a culmination of all the wisdom. It's been 6th in the series, and still the wisdom is like unfathomed. There's global input, global information converging. Thank you so much, everyone. I would now request Dr. Lakshmikant Palo, CEO, People to People Health Foundation, and Mr. Koki Sato, General Manager, India Takeda, for their closing remarks. Dr. Palo, please.
Thank you, Dr. Mahapatra. Can you hear me?
Yes, sir.
Yeah. So I think this is a very wonderful conference, and thank you, speakers and participants, for attending the conference. And there are many new knowledge, even particular to me also. Really I enjoyed the listening. All the sessions. We need to work together for some urgent actions. Around this issue, and to improve the lives of people living with rare disease. So a comprehensive framework is more important to bridge the gaps on capacity, on infrastructure, diagnosis, awareness, provision for services, medical care, and access to treatment, and lack of data and research. We talked about more on that also during this conference. And most importantly, the finance for treatment. That's very key, and we need to work together how we can mobilize our efforts together towards this direction. So more coordinated actions are needed with all the key stakeholders for a successful implementation of the program, and also address these challenges related to rare diseases. So invest more, and allocate more. That is one message I would like to share, and take home lesson for me also, and no one leave no one behind. That we have to work together, and we must change the way we operate. I think our operating models probably we need to change so that we have more impactful actions towards the issue, and we must make more commitment which are more tangible, and having more smart objectives, the way that we measure, more specific, measurable, achievable, relevant, and time bound. So these are some of the areas we need to work together, and to make sure more sustained progress. People to People Health Foundation is striving to continue bringing stakeholders together and work on the key issues, how to improve this different critical drivers related to rare disease, And there are some kind of action agendas we need to work together more collaboratively and collectively. How to increase kind of awareness and investment, that is critical. And we have been seeing that throughout the whole series of journey that kind of we have on this issue, and many experts, speakers, and kind of are talking about that. So that's one of the critical kind of call to action. Mobilizing partnership, we need to have more partners, even at the national level, subnational level, international level, all key stakeholders who are not into part of this group, maybe including them and looking the leveraging more kind of resources and commitment towards the issue. And orientation of national policy and guideline, that's very important, so that we have more comprehensive national policy on rare diseases, as we are hoping that India policy will be released very soon. And high level commitment, we need to kind of work together, more high level institutional leadership kind of for rare disease at the high level, so that the all stakeholders are building their consensus and also committing to the rare disease. Reserve knowledge gaps, because we have seen that a lot of research gaps and new areas of research need to be done. So that's one area. So routine program monitoring, data collection, data analysis, and new research, kind of an innovation. We need more resources around those areas to work together. And of course, kind of research and development is kind of more continuous, long-term. Some scientific breakthroughs on the treatment protocol, gene therapy, bringing solutions and to lesser the severity of the disease, and how to improve the quality of life of people living with rare disease are more critical. So we need to invest more in research and development of new drugs and scientific breakthroughs. So let us work together on this call to action, and so that we can impact the lives of people living with rare disease. Thank you.
Thank you, Dr. Paulo. I would now request Dr. Koki Sato for his message.
Thank you. Thank you for giving this opportunity. It's a great pleasure to be a part of this great conference. Indeed, that I'm also truly inspired by speakers, panelists today that really demonstrate commitment and effort to support the rare disease patient in India. At the same time that we have also understood that there are still challenges to be addressed. And in India, that requires strategic collaboration partnership highlighted by different speakers and panelists today in the area, especially awareness, diagnosis, capability building, education, innovative access scheme, clinical research, and so forth. We, Takeda, as a value-based research and development-driven biopharmaceutical company, is highly committed, continuously discovering, delivering life-transforming treatment guided by our commitment to patient. In the area of rare diseases, it is our imperative to improve, accelerate access for patients by working closely, collaboratively with the different key stakeholders to further strengthen healthcare system through strategic partnership. So we do very much looking forward to further collaborative working together with different stakeholders for the rare disease patient in India. Thank you so much.
Thank you, Dr. Koki, for your remarks. So this was the closing remarks coming from Dr. Paulo, CEO PPHF, and Mr. Koki Sato, General Manager Takeda, India. Now, before I thank everyone, we have one very small presentation from LSDSS. It's a balloons releasing ceremony marking the new beginning. I would request the backend team to help out with this ceremony, and then we can come back to conclude. Right, team? Is there anything, any glitch over there? Right, while the slide is being uploaded, let me take this opportunity to thank the audience for staying with us. We have overshot the timelines by 10 minutes, but thank you for staying along with us. Yes, I guess we're getting the video. Right, there seems to be some kind of audio sync glitch over there. Right, thank you for bearing with us. Like technology has its own advantage as well as some blockades at times. Today we had a fairly seamless session. Yes, fantastic. Thank you for that cute short video. It's a new beginning indeed. So much of wisdom converging into a couple of hours of interactions we have had. Years of hard work, so much of lived experience, and of course, passionate, relatable effort. Thank you so much, our audience and supporters across the globe. Thank you, our speakers for the day, the moderators, above all our guests of honor. Thank you so much, and we shall stay connected. See you. Bye.
Thank you very much. Good night.
Thank you, audience, as well. Thank you.
Bye.
Bye. Bye.
Thank you. Thank you.